The chair now recognizes himself for 5 minutes for an opening statement. Welcome to today's hearing entitled Schemes, Real Harm, Examining Fraud in Medicare and Medicaid. Recent criminal prosecutions and continued allegations of fraud in the state of Minnesota's Medicaid and other benefit programs have shown a spotlight on how vulnerable these programs are. Americans are outraged. Any amount of waste, fraud, or abuse of resources and taxpayer funds is too much, but it's particularly alarming when it happens on a scale as large as what's being uncovered in Minnesota. What's happening in Minnesota's Medicaid program is critical and worth discussing, but it is just the tip of the iceberg. Medicare and Medicaid fraud is common. It's happening nationwide, and it has been egregious for decades. Some estimates place annual Medicare and Medicaid fraud losses at $100 billion annually. This is only a conservative estimate because fraud can only be accounted for if it's detected. The Government Accountability Office placed Medicare on its inaugural high-risk list in 1990, and it's remained there ever since. Medicaid has also joined Medicare on the high-risk list in 2003. The Department of Health and Human Services Office of the Inspector General has also sounded the alarm on the unsustainable rate of waste, fraud, and abuse. We have to adjust and address this issue. Here are just some of the examples of the fraud schemes that we are seeing today in these programs. In New York, an adult daycare owner defrauded Medicaid over $68 million through illegal patient referral kickbacks and bribery schemes. In Arizona, a man based in Pakistan and the United Arab Emirates allegedly billed Arizona Medicaid $650 million in a fraud scheme targeting the homeless and Native Americans seeking substance abuse treatment. In another case last year, 7 defendants across Arizona and Nevada were charged in connection with an alleged $1.1 billion Medicare fraud scheme for medically unnecessary amniotic wound allografts, commonly known as skin substitutes. And just a few weeks ago, a Florida laboratory owner pleaded guilty to a $52 million in medically unnecessary genetic tests billed on behalf of Medicare beneficiaries. In all of these cases, patients suffer from unnecessary, inadequate, or a complete lack of medical care. In other cases, patients are unknowingly victims of identity theft or misleading marketing practices perpetrated by these fraudsters. And as highlighted in one of the above examples, nation states and overseas criminal gangs are also targeting Medicare and Medicaid. Recent medical criminal indictments and convictions show the trend is getting worse and exemplify the scale of the fraud. It has been said that healthcare fraud is becoming easier and more lucrative than the illicit drug trade. Patients will suffer if these healthcare programs cannot continue on responsible fiscal paths. It is our duty in Congress to protect these programs for our most vulnerable Americans. American taxpayers place hundreds of billions of dollars into Medicare and Medicaid. We must do better to protect these programs from fraud that is draining them of billions of dollars annually. We applaud law enforcement efforts that investigate fraud and prosecute fraud, but we can save more money by detecting and preventing fraud before it even occurs, rather than paying and chasing funds after they have already been dispensed to the criminals. The increased focus on this subject from Dr. Oz, the administrator of CMS, has also been an important improvement over the previous administration. I want to thank our witnesses for being here today. Your knowledge about this important topic will help us understand the challenge of Medicare and Medicaid. As our witnesses will testify today, these are real, legitimate fraud schemes. With that, I now recognize our ranking member of the subcommittee, Ms. Clark, for her opening statement.
Thank you very much, Mr. Chairman, and good morning, everyone. If we really want to get serious about fraud, the administration needs to stop terrorizing our communities. Red line after red line has been crossed by this administration. First, Renee Good was shot and killed by a federal agent while out protecting her neighbors. Instead of investigating her killing, Stephen Miller, Secretary Noam, and Vice President Vance claimed that Renee was carrying out domestic terrorism. Then Alex Preddy, who worked as a VA ICU nurse multiple times and killed by 2 federal agents while he was protecting a woman that officers had shoved to the ground. Secretary Noam called him a domestic terrorist, and Stephen Miller called him an assassin. This past week, journalists Don Lemon and Georgia Forte were arrested just for reporting on a protest at a church. Several protesters were also arrested in the White House. Not content with merely arresting these individuals, even released an altered photo of one of them to make it appear as if she was crying. An individual in ICE custody sustained 8 skull fractures that ICE officers said were caused by running into a wall, but medical officials said that the patient's injuries could not have been caused by running into a wall. ICE said that another man who died in ICE custody was attempting suicide, and staff was trying to save him. But we learned later from his autopsy that he was actually suffocated when he was held down by guards in a detention facility. It is lie after lie after lie from this administration, and it's only getting worse. Our children are not safe. A 5-year-old boy was used by federal agents as bait to lure out members of his family and community from their house. The other day, children in Portland were tear gassed while participating in a peaceful protest. And it's not just happening in cities. Recent video from rural Minnesota show masked federal agents pulling in front of the vehicle of an observer, getting out with guns drawn and aiming them at the driver. That's just a sampling of the horrors that we've seen. And these are only the ones that we know about because brave citizens have been out there on the streets recording. I can only imagine how many more abuses are happening away from the cameras. No one is exempt from the tyranny of this administration. And any of my colleagues who think they or their constituents are somehow immune from this administration's flailing cruelty better wake up quickly because it could be your community next. Now, what does all of this have to do with fraud? Don't ask me. Ask Attorney General Bondi, who has justified the continued presence of federal agents in Minneapolis due to the existence of fraud in that state. In a letter she sent on January 24th, Attorney General Bondi tried to extort Minnesota by seeking voter data and other sensitive records in exchange for relief from federal terror. And in doing so, she referenced the letter sent by committee Republicans investigating fraud in Minnesota. It was truly a dark day when this committee's reputation is used to justify the oppression of American communities. Our country was founded by people who stood up to the tyranny of a mad king across the ocean. But now, the tyranny and madness is coming from inside the House, specifically the White House. We have seen image after image and video after video of outrageous abuses, any of which could have scandalized any other administration. But for this administration, there's clearly no bottom and totally inability to feel shame. I can assure you that when Democrats are back in charge, we will not sit by silently while the president runs roughshod over the Constitution and the American people. And to the people of Minnesota and other communities who are living in fear, I want you to know that on my side of the aisle, we hear you, we see you, and we will keep fighting for you. With that, Mr. Chairman, I yield back the balance of my time.
Thank you. The chair now recognizes the chairman of the full committee, Mr. Guthrie, for 5 minutes for an opening statement.
Thank you. Thank you, Chairman Joyce. I appreciate you for holding this hearing, and I really appreciate our witnesses being here today. Today's hearing sounds the alarm on the tremendous loss of taxpayer dollars to fraud and the real consequences for patients, providers, and the public trust. Together, Medicare and Medicaid provide health coverage to more than 140 million Americans, including seniors, people with disabilities, low-income families, pregnant women, and children. These programs are lifelines, not abstract budget figures. When they are exploited and plundered, Americans lose access to care, confidence in the system, and resources intended to improve those health outcomes. Each year, tens of billions of dollars are lost to fraud, waste, and abuse. But financial loss is not only the consequence of these fraud schemes. When providers bill for services never rendered or criminals flood Medicare or Medicaid with fake claims, the system becomes harder to oversee, less responsive to legitimate patients, and financially unstable. Healthcare costs rise for everyone, and trust in these critical programs erode. Operation Gold Rush illustrates the growing scale of the problem. This recent nationwide enforcement action by the Department of Justice was the largest healthcare fraud takedown in history. This operation targeted several healthcare fraud schemes, leading to criminal charges against 324 defendants in 50 federal districts and 12 state attorneys general's offices across the U.S. The various schemes involved over 14.6 billion in intended loss. 29 of those defendants were charged for their roles in transnational criminal organizations that used stolen identities of over 1 million Americans spanning all 50 states to submit over $10 billion in fraudulent claims to Medicare for durable medical equipment that patients never ordered or received. Many seniors learned that their Medicare or other personally identifiable information had been compromised only after being denied legitimate care. This is not an administrative error. It was organized crime exploiting our nation's healthcare programs. We must ensure taxpayer dollars are used for quality healthcare, not siphoned off by criminal enterprises. Republicans took steps in this in H.R. 1, and we must continue the effort to preserve Medicare and Medicaid for those who need these programs. I look forward to hearing from our witnesses. I appreciate you all taking the time to be here today. And with that, Mr. Chairman, I appreciate this hearing, and I will yield back.
Thank you. The chair recognizes the ranking member of the full committee, Mr. Pallone, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. As anyone who has been around long enough knows, fraud is a very real, persistent challenge. Fraud happens in both red states and blue states. But the word fraud has unfortunately become a convenient excuse for Republicans that do just whatever they want. Their solution to combating elusive claims of fraud in Medicaid was cutting millions of Americans off of their health coverage and instead giving money to companies like Deloitte to push eligible beneficiaries off of the Medicaid rolls. Republicans' big ugly bill is cutting $1 trillion from our healthcare system while also stripping healthcare away from 15 million Americans and closing hospitals and nursing homes all around the nation. And now fraud is being invoked as a justification for federal agents terrorizing communities. The Trump administration is using claims of fraud in state programs, including Medicaid, as an excuse to recklessly deploy Department of Homeland Security DHS officials from Immigration and Customs Enforcement, ICE, and Customs and Border Protection in Minneapolis, Minnesota. But it has become clear that this was purely a pretext for the administration to continue targeting the states and cities President Trump views as political adversaries. Instead of providing assistance to Minnesota and other states in protecting federally funded programs from waste, fraud, and abuse, the Trump administration is mobilized to take drastic punitive measures that do nothing to harm the bad actors that perpetrate waste, fraud, and abuse, and instead harm the people who count on these programs for their health care and their livelihood. In December, the Department of Homeland Security began Operation Metro Surge in Minnesota with the alleged purpose of cracking down on fraud and illegal immigration. Since that time, 2 innocent Minnesotans, Renee Good and Alex Petty, have been shot and killed by federal agents, and countless more have been terrorized and traumatized. Renee Good was shot multiple times, and federal agents on the scene refused to allow a doctor who was on site to administer first aid. Rather than investigating the shooting, the Department of Justice instead pushed prosecutors to investigate Renee Good and her widow. At least 14 federal prosecutors as of today have resigned in protest. All told, the Minnesota U.S. Attorney's Office, which handles these fraud cases or prosecutions, is at half its strength. Alex Petty was an ICI nurse who worked at a VA hospital. Video shows he was trying to assist and protect a woman who had been shoved by an agent where he himself was tackled by multiple agents and then shot by two of them. These are two lives lost in a matter of weeks due to the unjustified invasion of federal forces into an American city on the pretext of addressing fraud. And the Republicans on this committee are complicit. Last month, the Attorney General Bondi sent a letter to Minnesota Governor Tim Walz seeking to extort sensitive health and voter data in exchange for federal forces withdrawing. In her letter, she cited to an investigation by committee Republicans as a justification. Now, the Department of Homeland Security operations in Minneapolis must cease immediately for the safety of all, and a thorough independent investigation must be conducted into these two murders. It's also time for the Trump administration to begin work with the states and communities that investigate and prosecute fraud. Instead of providing assistance to Minnesota and other states in protecting federally funded programs from waste abuse, the Trump administration has mobilized to take drastic, punitive measures that do nothing to harm the bad actors, as I've said before. It's also, after all, when it comes to taking real productive steps to prevent and punish fraud, the Republicans failed to do so. Committee Republicans have ignored our request for a hearing to examine Trump's firing of at least 17 inspector generals, including the Inspector General of the Department of Health and Human Services. Inspector generals are the very people who work to prevent and detect fraud and abuse in our federal agencies, and Republicans have silently stood by as Trump fired 17 of them. Now, Republicans also refused to join us in raising concerns when DOJ pushed out career staff at the HHS office of the Inspector General, and they haven't said a thing about Trump continuing to pardon criminals who were convicted of Medicare and Medicaid fraud. If you want to get serious about waste, fraud, and abuse, start with President Trump and the harm he's doing to our nation. His federal agents are laying waste to our communities. His actions are making fraud worse, not better, and he is abusing his authority every day. And with that, Mr. Chairman, I yield back the balance of my time.
The gentleman yields. That concludes members' opening statements. The chair would like to remind members that pursuant to the committee rules, all members' written opening statements will be made part of the record. We want to thank our witnesses for being here today and for taking time to testify before the subcommittee. You will have the opportunity to give an opening statement followed by a round of questions from members. Our witnesses today are Jessica Kaye, Vice President and Co-founder, Integrity Advantage; Lynn, Wootton, President, National Association of the State Medicaid Fraud Control Units; Stephen Nuckolls, Chief Executive Officer, Coastal Carolina Healthcare, the Treasurer and former Board Chair of the National Association of Accountable Care Organizations; and Jessica Tillipman, Government Contracts Advisory Council Distinguished Professor Lecturer in Government Contracts Law, Practice and Policy at the George Washington University Law School. We appreciate all of you being here today and I look forward to hearing from you. You're aware that this committee is holding an oversight hearing, and when doing so, has the practice of taking the testimony under oath. Do you have an objection to testifying under oath? Seeing no objection, we will proceed. The chair advises you that you are entitled to be advised by counsel pursuant to House rules. Do you desire to be advised by counsel during your testimony today? Seeing none, please rise. Raise your right hand. Do you promise to tell the truth, the whole truth, and nothing but the truth, so help you God? Seeing the witnesses answered in the affirmative, you are now sworn in and under oath, subject to the penalties set forth in Title 18, Section 10001 of the United States Code. With that, we now recognize Ms. Kaye for 5 minutes to give an opening statement.
Chairman Dr. Joyce, Chairman Guthrie, Ranking Member Pluen, Ranking Member Clark, members of the subcommittee, thank you for having me here today. My name is Jessica Kaye. I'm currently the Vice President and co-founder of Integrity Advantage and the President of the Maryland chapter of Certified Fraud Examiners. For over 50 years, I've partnered with more than 60 payers across Medicare, Medicaid, FEHBP, commercial plans, CHIP programs, conducting fraud, waste, and abuse detection, analysis, and investigations. The healthcare industry is about $5.3 trillion spent in 2024, and we estimate as high as $500 billion of that is FWA. We process nearly 30 million claims a day across well over 1,000 payers with varying rules, coverage determinations, and data elements. Oversight of this magnitude is bound to need attention. FWA is not a victimless crime. Unnecessary services expose patients to real medical risk, while fraudulent billing drains resources intended for those who legitimately need it. Patient harm occurs through unnecessary or unsafe for the sake of reimbursement. Overall, patients suffer in reduced access. And we are the patients. The taxpayers are also the patients, in this scenario. Taxpayers, we're paying for it twice. We're paying for the FWA that is on top of the already big spend, as well as the rising costs for our individual healthcare. And the honest providers whose reputations suffer as fraud undermines the trust of our healthcare system. Common schemes in this area, some of which were already addressed, include behavioral analysis services. These are a huge issue across Medicaid fraud, and we see missing records completely, unqualified staff, billing that is inconsistent with authorizations, treatment plans that are not tailored to these members' needs, and excessive services. Non-emergency medical transportation continues to be an issue as well. We have trips to nowhere, inflated mileage, and upcoding to higher services. Home and community-based services also continue to be a big issue. We see falsified state authorizations, round-the-clock services for low acuity diagnoses, including prevention, and billing for one-on-one when delivering care to many patients in one home. Laboratory services and genetic testing continue to be a problem. We mentioned skim substitutes, which is really a highly targeted area due to excessive units. I've seen payments for secondary payers up to $30,000 for one member, and that's after Medicare already paid their portion. DME continues to be an issue. These are not isolated issues to one state or one payer. They are discussed consistently across national platforms and anti-fraud forums. Of course, we have a lot of challenges in anything this big, and we could do better. Some of the things that I would recommend is a look at policy. I would invite fraud professionals to the table as we design policy and we think about benefit coverage. We have a different perspective. We tend to think about the holes as a fraud professional, but generally we see inadequate state, federal, and plan level policies that result in inconsistent and unenforceable coverage rules. We need to strengthen our frameworks with clear coverage guidelines and federal defaults in the event that states or plans lack sufficient definition. We need resources. And I'm not just talking people, whether that's people, process, technology. Things are changing and the fraudsters are winning. We need to keep up with that, and we need some collaboration there, and therefore efficiency between the state, the federal, the commercial players, whether that's through data and joint investigations. And for those that know me, I'm just bringing up data as the last point, but data is a big issue in healthcare fraud. We have complicated data and poor data criteria in general. It's very inconsistent and hard to understand, with limited visibility into provider credentialing, sanctions, and improved tracking of rendering personnel. Healthcare FWA harms patients. It undermines legitimate providers. It drains taxpayer resources and increasingly funds sophisticated criminal networks. With stronger policy, better technology, and enhanced collaboration, we can significantly reduce the waste and protect the integrity of our healthcare system. I'll give you my time back.
Thank you. Ms. Wootton, you are now recognized for 5 minutes for your opening statement.
Mr. Chairman, Chairman Guthrie, Ranking Member Clark, Ranking Member Pallone, and members of the committee, thank you for this opportunity to testify. My name is Kaye Wootton, and I am testifying as President of the National Association of Medicaid Fraud Control Units, known as NAMFUCU. I also serve as Director of the Medicaid Fraud Control Unit in Utah, or MAFUCU. And with me today are NAMFUCU Vice President F. Edward Kirby, who also serves as the MAFUCU Director in North Carolina, and Barbara Zellner, Executive Director of NAMFUCU. Chairman Joyce, you recently said ensuring Medicaid program integrity is critical to preserving access to vital healthcare services for those that need it most. Every dollar stolen from the Medicaid program by fraudsters is taken from children, pregnant women, the elderly, and people with disabilities. We agree. Medicaid fraud control units are state-based law enforcement agencies established in the late 1970s to address these exact concerns. Our twofold mission is to investigate and prosecute fraud committed by providers against the Medicaid program and resident or patient abuse, neglect, and misappropriation of patient funds. To address these problems, MAFUCUs utilize both criminal and civil enforcement actions. MAFUCU actions are often filed in state courts, but MAFUCU attorneys may be cross-designated as Special Assistant U.S. Attorneys, or SAUSAs, and prosecute in federal court. As a SAUSA, I value the opportunity to partner closely with the U.S. Attorney's Office and federal agencies such as HHS-OIG, FBI, DEA, and others who investigate healthcare fraud. State program integrities are also critical for identifying and referring provider fraud cases, and numerous state partners refer cases of abuse and neglect. At times, Mafuku cases overlap with cases of abuse and neglect. For example, a Mafuku receives a referral for allegations of resident neglect, and an investigation shows that the resident was indeed neglected. It would not be complicated in that scenario to charge an aide or a nurse for the direct care or lack of care for that resident. But Mafukus have to dig deeper nowadays and hold higher level staff accountable for funds being shoveled off to profits rather than resident care, understaffing so prevalent that employees cannot provide adequate care, and other schemes. Only through these complex cases are we able to hold the real perpetrators accountable and improve nursing home conditions. I have been a registered nurse since 1984. It was not until late in life that I became an attorney and started working for a Mafuku. At first, I believed that providers must have gotten into healthcare for the right reasons and then gone astray and committed fraud. While that is likely true for some defendants, what we're now seeing is far more sinister. Companies are being created for the purpose of committing fraud. For example, last year, the Mafuku directors in the Western Namfuku region met to share fraud schemes and collaborate on ways to combat fraud. Through these conversations, we learned of a substance use disorder fraud that started in Nevada, where multiple people were convicted. Then it moved to Arizona. In Arizona, those providers could not treat patients because they had been excluded by HHS-OIG. So instead, they taught others how to commit fraud. Arizona has charged and convicted many people there, but as we met, we realized it's unusual when we have open criminal investigations to share the name of fraudsters or potential defendants. But we became aware that this environment is now different. We became aware that it was the only way to get on top of these schemes is to be able to collaborate more openly. As a result, we have collaborated and now have open cases in numerous states. In Utah, we have 6 open cases with the same parties that were involved in Arizona and Nevada. Namfuku creates this a bipartisan forum for all Mafukus to collaborate and trains Mafuku staff how to identify and prosecute fraud. Namfuku has also coordinated a large number of multi-state federal investigations since '92. These global cases have resulted in over $12 billion to the Medicaid program. The return on investment is invaluable. In March of 25, HHS-OIG published the Medicaid Fraud Control Unit annual report and reported a total of 1,151 convictions, 1,042 individuals excluded from federal programs, 493 civil judgments totaling $1.4 billion. Again, Chairman Joyce and committee members, thank you for this opportunity to testify, and we at Namfuku are proud to be part of the efforts aimed at solving these problems.
Thank you. Mr. Nuckolls, you are now recognized for 5 minutes for your opening statement.
Chairman Guthrie, Chairman Joyce, Ranking Member Pallone, Ranking Member Clark, and members of the subcommittee, thank you for the opportunity to testify today. My name is Stephen Nuckolls, and I serve as the Chief Executive Officer of Coastal Carolina Healthcare, an independent, physician-led practice in Eastern North Carolina. I'm also a board member of the National Association of ACOs. I view fraud, waste, and abuse through 2 lenses: as a rural medical practice where fraudulent billing disrupts patient care, and as an ACO, accountable for both costs and quality. Fraud is not an abstract budget problem. In Operation Gold Rush, authorities stopped a transnational scheme that used stolen identities and purchased DME companies to bill $10.6 billion in fraudulent claims. Medicare largely did not pay, but coordination of beneficiary protections fell short. Here are the consequences. First, direct patient harm. When fraudulent claims appear in a beneficiary's record, legitimate medically necessary items can be delayed or denied because coverage appears to be exhausted. For example, one of our patients needed a therapeutic diabetic shoes, but Medicare records showed shoes had already been provided by an out-of-state supplier, which our patient never received. The supplier was no longer operational, and the patient ultimately pay out of pocket for the shoes. That is the harm: legitimate care denied because fraudulent billing contaminated the record. Second, increased cost to the healthcare system. When CMS follows Department of Justice guidelines and pays suspected fraudulent claims into escrow while an investigation proceeds, supplemental insurers are required to pay those claims. The Operation Gold Rush indictment indicated that Medicare supplemental insurers paid roughly $900 million to DME companies involved. Those costs are passed along to beneficiaries through higher supplemental insurance premiums. Third, hindering the growth and adoption of value-based care and ACOs. ACOs are charged with improving quality while managing total cost of care. Yet in traditional Medicare, ACOs and treating clinicians do not have the same practical tools that Medicare Advantage plans use to prevent fraud, such as prior authorization, prepayment review, and supplier controls. Instead, ACOs operate a pay-and-chase environment. We can identify and report suspected patterns, counsel patients, but we often see the same billing continues for months with no visibility into enforcement. This uncertainty is especially serious for ACOs in two-sided risk, where we repay CMS if spending exceeds the benchmark provided. My practice is in the 100% risk ACO reach track. In 2025, we identified $6.3 million in suspected fraudulent DME claims from 6 companies. In our Arizona market, these claims were more than $1,000 per beneficiary per year. That's triple the national average for DME from just a few years ago. Yet we don't know if these claims were paid, held in escrow, or whether we will be held financially responsible for them. That uncertainty undermines confidence in the model and discourages participation in value-based care. And if organizations like ours are forced to exit, we would have to end successful programs that have rooted out fraud, reduced wasteful spending, and likely our community average over time would revert back and would roughly increase 25% in our market. Even after Operation Gold Rush, fraud continues to harm Medicare beneficiaries, ACOs, and taxpayers. My written statement highlights several ways where my colleagues at other ACOs have seen ongoing fraud over the past year, including concerning spikes in durable medical equipment, billing, and misuse of skin substitutes. To improve coordination and beneficiary protection after detection, we recommend the following. First, close the reporting feedback loop, acknowledge reports, provide case status, and notify impacted ACOs and secondary payers when high-confidence fraud is detected. Second, create rapid notification and beneficiary-friendly record correction process. Third, strengthen DME supplier integrity. One simple way to do this would be to require surety bonds as a way to accomplish this. Lastly, hold ACOs harmless for fraud outside their control by excluding fraud, waste, and abuse from expenditures. ACOs are willing to reduce wasteful spending and deliver better care, but we need timely information and aligned accountability so that fraud is stopped before it harms patients and those trying to do the right thing. Thank you.
Thank you, Mr. Nuckolls. Ms. Tillipman, you are recognized for 5 minutes for your opening statement.
Thank you. Chairman Joyce, Ranking Member Clark, Chairman Guthrie, Ranking Member Pallone, and the members of the subcommittee. Thank you for the opportunity to testify today. My name is Jessica Tillipman, and in addition to leading the government procurement law program at GW Law School, I also teach a course on anti-corruption and compliance. I begin every semester with a simple reminder: no system is immune to misconduct. And when programs are large, complex, and responsible for trillions in public spending, the risk of abuse increases. That understanding shapes the oversight architecture of Medicare and Medicaid. These programs assume misconduct will occur and are designed with multiple layers to address this persistent challenge. Inspectors General, the Government Accountability Office, the Department of Justice, whistleblower incentives, and state fraud control units overlap by design. That structure avoids a single point of failure and creates multiple detection and enforcement channels to give the government the best chance at preventing, detecting, and mitigating fraud. But redundancy only helps to deter fraud when 3 other conditions are present. The oversight bodies coordinate, they have stable capacity, and they are credibly independent. When any one of those breaks, the system becomes slower, more fragmented, and easier to exploit. The evidence shows the system can deliver results when it is appropriately resourced and coordinated. Last year, the False Claims Act recovered $6.8 billion, more than 5.7 of which was from healthcare. And the 2025 National Healthcare Fraud Takedown, 324 defendants were charged in schemes involving alleged intended losses exceeding $14 billion. Those results reflect important enforcement work, but they also illustrate a reoccurring pattern. We tend to focus public attention on episodic, high-profile surges. Those surges can be valuable, but they do not substitute for the routine controls that prevent everyday losses. In my experience, many of the most important solutions are, frankly, not that glamorous. Robust data infrastructure, risk-based screening and verification practices, and the implementation of open GAO and IG recommendations. That is also what sustains public confidence, because people trust systems that apply rules consistently and do the basics well. With that frame, I want to highlight 3 areas where the system remains particularly vulnerable. First, there are well-known verification gaps in enrollment and prepayment screening. Programs must balance access and program integrity. The solution must be risk-based, stronger front-end controls where feasible, and targeted post-payment tools when they're not. Technology is also part of that verification story. Advanced analytics and AI can strengthen detection and verification, but only with strong data infrastructure, transparent governance, and meaningful safeguards. But the same tools that help in the fight against fraud can also be used against it. In the 2025 National Healthcare Fraud Takedown, DOJ charged defendants who allegedly used AI-generated audio to fabricate beneficiary consent, underscoring how quickly bad actors adapt. Second, some services are harder to validate because they lack the built-in controls of facility-based care. Telehealth has no physical presence. Home health occurs in private homes. Durable medical equipment is shipped directly to patients. In these settings, a single encounter may generate multiple claims, and verification is increasingly more difficult. Third, managed care distributes program integrity responsibility across states and plans. More than 70% of Medicaid beneficiaries receive care through managed care arrangements. When responsibility is diffuse, accountability depends on clear referral pipelines and feedback loops. Audits have flagged gaps in referrals, coordination, and follow-through, and those gaps are not confined to any one state. These vulnerabilities highlight a deeper oversight challenge. Fraud, waste, and error are often treated as interchangeable, but they are not. Fraud is a legal conclusion requiring proof of intent. Recklessness can trigger False Claims Act liability. Improper payments may result from documentation gaps or administrative error. Each of these issues is important, but each requires a distinct remedy. When every error is labeled fraud, we risk misdiagnosing the problem and applying the wrong solution. I'll close with this. Medicare and Medicaid already have robust oversight structures. The question is whether those structures are functioning as designed. Deterrence requires redundancy, coordination, stable capacity, and credible independence. Thank you. I look forward to your questions.
I thank you all for your testimony. We will now move to questioning. I will begin and recognize myself for 5 minutes. Mr. Nuckolls, beyond durable medical equipment, ill-intentioned providers are increasingly turning a profit by ordering expensive wound care supplies, also known as skin substitutes. Why are skin substitutes vulnerable to fraud and abuse?
That's a great question. I think the main reason that we've seen so much fraud in this is the large profit margins that providers have make when they utilize these products. Under the FDA clearance, the prices are not set by Medicare, and they have increased substantially. We in the ACO community have brought this issue up to CMS and to others for multiple times. We've asked for local coverage determinations to come in on this. The good news is that Secretary Oz has a decisive program that he implemented for starting January 1. And from the industry observers that I've talked to and other providers, I believe this problem is solved.
So you referenced that what happened January 1st was moving to skin substitutes to have a flat rate with the goal of reducing the fraud that had driven the high costs. Again, can I ask you for the record to reiterate, do you believe that this reform will reduce fraudulent or excessive billing for these services for skin substitutes?
It will absolutely reduce it, and I believe it will eliminate it.
Ms. Gay, are there fraud, waste, and abuse risks in state Medicaid programs when providers are allowed to self-attest to becoming enrolled?
I do believe. I will say most of my experience is not working directly with the states, but with managed care organizations and Medicare Advantage plans. But I do think that there needs to be additional oversight in our self-reporting across the board for eligibility, both for provider participation as well as member eligibility.
Do you think that there's increased risk of fraud in state Medicaid programs that provide services that are billed hourly, such as personal care services or adult daycare?
Absolutely.
New York's consumer-directed personal assistant program is under scrutiny due in large part to the increases in spending and the lack of provider oversight. In CDPAP, individuals hire their own caregivers, including immediate family members that are paid through a fiscal intermediary to provide assistance with daily living activities. In one case, a man signed up to be a personal caregiver for 10 relatives. To get away with this scheme, this man's brother posed as their mother, a recipient of Medicaid home care services herself and other welfare benefits. However, there's a little detail that was missed. She lives in Bangladesh, and she lived in Bangladesh for the entire time. This man was eventually caught and convicted for his crimes. Ms. Gay, are you aware of other state Medicaid programs or similar program designed to CDPAP for personal or home care services?
Yes.
What are the issues that you have identified with how this program and the category with that structuring has opened the door to so much overt fraud?
I think one of the things that we see that might be helpful, so oftentimes these personal care services are being rendered by somebody that doesn't have an MPI. An MPI is your national provider ID that you are supposed to use to bill. If I am setting up care for my mother, I don't have one of those IDs, and that billing goes under a TIN for an organization that I might be working with. So there's a discrepancy or a challenge, I guess, in how we look at that claims file data, and there's also disparate data sources. So if I am working through one MCO for one member and another MCO for another member, they can't see that I'm rendering services to multiple members, nor can they potentially see that it's me individually rendering those services at all. So there really is some data issues. I think our system was initially more designed for providers and practitioners that were billing services. And now that we're extending those services with good intention, we're creating other limitations in our ability to fight back.
Ms. Wootton, the HHS Office of Inspector General has recently begun a targeted review of fraud, waste, and abuse in Medicaid non-emergency medical transportation programs. In some cases, we have seen these non-emergent medical transportation providers bill for impossible amounts for the daily service, such as scores of unique trips that cover thousands of miles in a single day, which we know is unachievable. What aspects of these programs open the door for fraud?
Thank you. Because individuals are performing services where you're not in a hospital where there's administrators overseeing the program and knowing if the services occurred. You will operate on a basis of trust. And we do see a great deal in the area of medical non-emergency transport. We see them billing for group rates or individual rates when groups are being transported. We see them billing for toll fees and other charges that were never incurred. We see ghost trips. Patients were never involved. And I think it is because they're a one-on-one type service or one on a small group that it's difficult to oversee.
Thank you. My time has expired. I now recognize the ranking member, Ms. Clark, for her 5 minutes of questioning.
Thank you very much, Mr. Chairman. I want to thank all of our witnesses today. Your testimony really centers us where we need to be, were we in a climate that we could actually get something done around this. However, federal immigration agents are terrorizing communities and children across this country. There are reports of school buses being pulled over while transporting students and being followed stop after stop to and from school. Families are avoiding public spaces, keeping their children home from school, and missing doctor's appointments. This experience of living in terror as kids can follow children through adulthood. Hardworking Americans and immigrants are afraid to go to their jobs. Restaurants and grocery stores, businesses, particularly now in Minneapolis, are struggling to make ends meet due to the pervasive fear that has gripped their community. All of this is due to the actions of an administration trying to justify its brutality, particularly against immigrants and minorities, as a response to fraud. First, on December 31st, 2025, a post on Truth Social, President Trump said, much of the Minnesota fraud, up to 90%, is caused by people who came into our country illegally. Low lives like these can only be a liability to our country's greatness. Send them back where they came from. Second, on December 19, 2025, Deputy Chief of Staff Stephen Miller appeared on Fox News and said, we should not be shocked when you import a population whose primary occupation is pirate, then they're going to come here and steal everything we have. Third, on January 6, 2026, post on X by the Department of Homeland Security stated, the largest DHS operation is happening right now in Minnesota. POTUS, Trump, and Secretary Noem have rallied DHS law enforcement personnel to keep Americans safe and eradicate fraud. We're not leaving until this problem is solved. I ask for unanimous consent for these three documents: the December 31st, 2025 Truth Social post, the transcript segment of the December 19th, 2025 Fox News interview, and the Stephen Miller January 6, 2026 DHS post on X to be entered into the record. Mr. Chairman?
Yes, ma'am, they can be entered.
Thank you. Ms. Tillipman, one of the things that both you and Ms. Wootton raised in your testimony is the importance of whistleblowers in rooting out fraud. I'm deeply concerned that whistleblowers will not come forward if they think that the federal government is going to use their allegations as part of an agenda that terrorizes immigrant communities. Why is it important for potential whistleblowers to have confidence that the federal government will use their allegations and evidence to root out fraud, rather than cynically use it to advance a partisan agenda?
Thank you for your question. Whistleblower
Your mic.
I think I actually turned it off. Whistleblower whistleblower regimes depend on confidence and comfort that when credible allegations are reported, that they'll be kept confidential, that the individual will be secure, and that they believe that a response will be taken in relation to their reporting. So those are important across the board, whether it's a government employee or it's a private citizen.
Thank you. Ms. Wootton, similarly, it is important for whistleblowers to have confidence in the intentions of the federal law enforcement. What happens when that confidence is lost?
As with any whistleblower, they need to be comfortable coming forward, telling the truth, and helping with the issue, not being focused on side issues. And those whistleblowers are vital because they often have inside information, whether they're transnational or not. They bring in information they may have seen firsthand with the provider, they may have experienced a fraud, and we need all whistleblowers to feel safe to come in and report those frauds so we can work with them to investigate.
Again, I appreciate all of your expertise, and I thank you for testifying today. I have one last document to enter into the record. This is the statement from the family of Alex Pretty, issued after Alex was murdered in cold blood in the streets of Minneapolis. It says, Alex was a kind-hearted soul who cared deeply for his friends and family, also the American veterans for whom he cared as an ICU nurse at the Minneapolis VA hospital. Alex wanted to make a difference in this world. Unfortunately, he will not be with us to see his impact. I ask for unanimous consent for this statement to be entered into the record.
So ordered.
I yield back.
Gentlelady yields. The chair now recognizes the gentleman from Idaho, Mr. Fulcher, for his 5 minutes of questioning.
Thank you, Mr. Chairman, and to the panel, thank you for your input today. I'd like to say that I enjoyed it, but not necessarily enjoy is the right word, but we need to hear it, and it's important information, so thank you. Question for Mrs. Gay first. I'm from the state of Idaho. Sometimes may not be the
the first state you think about when there might be fraud, but that is kind of the basis of my question. Have you noticed any trends where states might get targeted or regions might get targeted as a function of potentially them having a lower barrier for entry or maybe perceived as not being as likely to be audited?
Absolutely. Fraud, we talk a lot in the industry how it can be regionally generated. It tends to start in one particular area, and then I don't know if they're all hanging out talking to each other or how that spreads, but it does tend to start in certain populations and then branch out from there based on controls. But certainly flying
So
under the
you
radar
see-
could be
You
something.
see that happening. Okay.
Oh,
That's
absolutely.
not surprising. I'm going to go to Ms. Wootton here next, but either Ms. Wootton or Ms. Kaye, if you have a comment. What if the bad actor is foreign? It's a foreign actor. How much of that, or do you see that? And if so, what kind of a challenge does that bring to potentially pursuing that fraud if it's perpetrated by a foreign actor?
Certainly, states have seen both fraud cases perpetrated by foreign and by U.S. citizens or people in the U.S. And from our perspective, as being a Medicaid fraud control unit, it makes no difference. We look at allegations, try to identify, is there something we can do about them? Is the dollar amount something we can pursue? Are we going to be able to get value back for the Medicaid program? Do we have the laws in place to prosecute whatever type of fraud is referred? And we move forward with that investigation.
Specifically, the laws is kind of what I was trying to get some clarification on. It's more gray pursuing a foreign actor, or is it? Are the laws in place necessary? The tools you need?
The tools are in place if the bad actor is in there or your own state, right? We can use our state laws and go after that person. Victims are also at risk when people commit fraud, and we work regardless of what their background is or what the risks are. I think there are state laws that we can follow and hold people accountable.
Okay, thank you for that. Mrs. Kaye, back to you if I may. What are some common fraud schemes that you run across? Just top 2, 3 maybe.
Yeah, I mean, I think some of the biggest ones, as I already mentioned, but the applied behavioral analysis is a huge scheme that we continue to see across, particularly Medicaid, non-emergency transportation. I mean, we see labs, we see a lot of the home and community-based services, and these are a broad range, and they vary based on the state, what their regulation is, what services are covered. That takes up a lot of our case time right now as an organization, working with these home and community-based, because these are not practitioners, these aren't physicians that are rendering services. So we see non-licensed individuals. It's very hard for us to know what's actually happening. And for myself and my organization, we see data per health plan and not necessarily aggregated data across
Okay, so maybe that's part of my next question. What's the trigger? What are some of the indicators you see? What are the red flags?
Yeah, I mean, some of the indicators are impossible days when we're looking at that feels impossible, and I'm just looking at one health plan in an area. I'm not considering all the other services that provider may be rendering. So impossible day is a big one. Outlier analysis is a huge tool of ours.
Okay, so I'm going to go to Mrs. Wootton, but again, either one of you, if you have input on this, but how are these schemes evolving, changing? What do you, more sophisticated, less sophisticated, more blatant? How are these schemes changing over time, and how are we tracking that?
Throughout the time I've been with Medicaid fraud, what we see changing most is, as I mentioned, these are not, for the large part, providers who are just doing a fraudulent act now and then. These are people who are committed to committing fraud. They're working on it. We see that fraud schemes cross state lines far more than they used to. That's why we need to collaborate to find out what's going on. Anytime we hear of a fraud, each state goes back, sees what they can find, and then we collaborate. I think that it's difficult, as we've put in some provisions into healthcare that are beneficial, like electronic medical records and different devices that make it easier for a provider. It's also more difficult on our end to be able to see, is it a legitimate document because electronic medical records can print off an amazing medical record that looks like a full service was done. Whereas in the past, if you'd had to write out that note, you might have seen what was really performed.
Thank you. Thank you for your input, feedback. Mr. Chairman, I yield back.
The gentleman yields. The chair now recognizes a gentlewoman from Colorado, Ms. Daggett, for her 5 minutes of.
Thank you so much, Mr. Chairman, and I want to thank everybody for coming today. All of us are concerned about fraud in Medicare and Medicaid. When we do these markups of these bills and we have these debates, so frequently people talk about fraud in these programs as if it's the beneficiaries who are committing the fraud. So, Ms. Wootton, I would like to ask you, what is the percentage of fraud in Medicaid that's carried out by providers versus the fraud that's carried out by patients themselves?
Thank you. I appreciate that question. Medicaid fraud control units and thus NAMFUCU, we only have the authority to pursue provider fraud unless the fraud is perpetrated in collaboration with a recipient.
Right. But how much of the fraud would you say is committed by the providers versus the patients?
I couldn't speak to the amount for the individuals exactly, but I would say far more is committed by providers, and the large dollar amounts are going to the large types of providers.
The large types of providers, yeah. And states like all of our states are constantly on the lookout for fraud. And Ms. Gay, I would agree with you. In Colorado, what we're finding lately, a lot of that fraud is from transportation. Just last week, there was a huge coding discovery in Colorado that showed that some people were getting $650 for a transportation under Medicaid versus what should have been $65. Last spring, Colorado's official actions uncovered a ring that improperly charged Coloradoans millions of dollars for non-emergency transportation, resulting in blocking $25 million in fraudulent payments. And I'd like to put in the record a Denver Post article from June 21st, 2026.
So ordered.
Thanks. So, Ms. Tillman, you said that adequate fraud investigation requires coordination on all levels of government. Is that correct?
Yes, that's correct.
And one of those levels is the federal government. Is that also correct?
Yes, that is correct.
Now, at the federal level, the Department of Health and Human Services Inspector General was one of at least 17 IGs terminated in the first days of this administration. So, Ms. Tillman, I would also suspect that you and probably the rest of the panel would agree that when you're going to hire inspectors general, they need to be qualified for the job, and they themselves need to be not committing fraud. Is that right?
Yes, of course.
Of course. Now, the inspector general who used to be there was a respected professional who honorably served in HHS for over 2 decades. He was replaced by Thomas March Bell, who was once forced out of a Virginia state government job for misspending taxpayer dollars. And I would ask unanimous consent to put into the record this Washington Post article dated June 17, 1997, about Mr. Bell.
So ordered.
Thank you. Now, Ms. Tillipman, about how many fewer employees are at the HHS Office of Inspector General now than there were at the beginning of this administration?
Well, I don't have the exact number. I believe in the OIG's office, it is in the dozens. At least.
It's about 200, and I would ask unanimous consent. I would ask unanimous consent to put a New York Times article dated January 9th, 2026 into the record, Mr.
So ordered.
Chairman. That's a loss of more than 10% of the employees in the office responsible for keeping watch for waste, fraud, and abuse in HHS. So, Ms. Wootton, I want to ask you, are states and Medicaid fraud control units better to detect and respond to fraud when the HHS IG office is fully staffed and well-resourced?
Certainly in all areas of fraud, to research it, we need a team of individuals who can work together to do that. And when there's a shortfall on one side or the other, we collaborate and make sure that we find the resources we can use to combat fraud.
Thank you. Last month, Department of Justice prosecutors who were leading the fraud investigations in Minnesota that the chairman talked about, resigned in protest after they were directed to investigate the widow of Renee Good, who was murdered by ICE agents in Minnesota. And just yesterday, an additional 8 prosecutors in the Minnesota U.S. Attorney's Office left in protest, leaving the office with fewer than 20 staffers. And so, Mr. Chairman, if everybody's who's supposed to be doing this enforcement is going to leave, I don't think that it's going to help very much to try to investigate waste, fraud, and abuse. And I yield back.
Gentlelady yields. The chair now recognizes the gentlelady from Tennessee, Dr. Harshberger, for her 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you to the witnesses for being here today. I'll start with Ms. Wootton. Are civil and criminal penalties sufficient to deter repeat offenders who commit Medicaid fraud?
They are, if we can find the scope of fraud that we're looking for. Unfortunately, you're sometimes finding the tip of the iceberg, but then we can prevent that fraud from continuing, and that helps. There are also penalties. I think the HHS-OIG exclusion that doesn't allow them to bill Medicare, Medicaid, sometimes is more impacts a provider more than a civil or a criminal line. But we try to use all of the tools as we combat fraud.
As long as they check that database. Is there evidence that repeat offenders can enroll as providers in Medicaid programs in other states after enforcement actions? And if so, why?
If the enforcement action has excluded them on the HHS-OIG exclusion, you would at least have remedies if they attempted to practice, because they are not allowed to bill government programs. It's more difficult if there are pre-filing resolutions and those are not public or criminally in a criminal database.
Absolutely. Do Medicaid fraud control units communicate and share information with one another to identify repeat offenders and recurring schemes?
Absolutely. We meet regularly. We meet with multiple MAFUCUs. We also meet with federal partners. 3 weeks ago, I was with CMS, DEA, FBI, OIG, all trying to get on top of this. And we even conduct training specific to certain types of fraud and teach nurses, auditors, investigators, and attorneys how to combat fraud.
There has to be red flags, and people know if you've been in the healthcare industry. I guess this is Mrs. Kaye or Ms. Wootton. Is physician participation or authorization required to perpetrate Medicaid or Medicare fraud schemes? Ms. Kaye?
If the proper controls are put into place, then yes, but oftentimes those controls are skirted in some way or another.
They totally are.
I would say another role of the MAFUCUs, besides investigating and prosecuting, we make program recommendations to the state Medicaid agency. And often those are to say, we believe this code or this practice may open doors to allow fraud, and we make program recommendations on how that can be improved. So we're trying to solve the future, not just convict the past.
Totally. Are all providers that commit fraud doing so willingly, or are there physicians that unknowingly participate in these schemes? Because not every physician or provider who's in charge of something knows what's being billed.
I think that's the difficult part of a MAFUCU investigation. You're trying to figure out who is culpable and who maybe didn't understand, right? It's shocking sometimes when a physician will say that they didn't understand the billing, but they seem to understand the service and getting through med school and everything else. But there are certainly innocent victims who get caught up in these schemes. I would say particularly in nursing homes, many of those staff members and providers want to do a great job, and they're unaware that the money's being siphoned off to investors or to other uses.
Given that physicians are meant to examine and know the patient before authorizing orders, how many providers, or do you have a percent of these providers who unwillingly know about these, really that authorize the fraudulent orders for, say, DME or testing?
That's a great question, and it's difficult sometimes because if a name appears on an order, it appears they've ordered it, and it takes boots on the ground to go out and interview them and say, is this your signature? What have you done here, right?
Oh my God.
And all of the programs where there's not oversight in-house, I owned a home health agency for many years, and there's a lot of trust goes into sending your staff into a home, getting a doctor's order from someone who's not in the home at the same time. So there are avenues that they can beat, and we try to study what's required in different types of healthcare so that we can figure out where could you commit fraud.
Well, you could use AI models to kind of, I mean, there's a million ways to do it, but thank you. Ms. Kaye, what aspects of current telehealth regulations can be exploited by criminals to perpetrate Medicare or Medicaid fraud? Because we'll be controlling the, changing the rules on telehealth pretty soon and extending those things. So where do we need to look at for the loopholes?
Yeah, I think we reduced barriers to care during COVID, and I'm not sure that all of those went back up. And some of that is to the convenience of many of us. We've probably experienced telehealth and been pleased that we didn't have to go out for those services. But when we reduce those barriers, oftentimes we do open it back up to fraud.
As across state lines, I think that was a big deal when we did that for COVID, and I can see how.
Absolutely.
Yeah.
And if I may, about rendering providers, one of the things that when I was talking to my team about like the so many solutions that we'd like to bring up, we have often talked to rendering providers and they have no idea that they are complicit in a particular scheme. And sometimes these are retired providers. There is not any type of feedback loop to somebody with a current MPI saying that you've been billing under these TINs. So when we look at DME or labs or those such things, they really don't have any indication until they get a letter either from an organization like mine or Ms. Wootton to say, what do you mean and how do you mean? And so that is absolutely like an area that's frustrating.
Well, my time is up, so I'll yield back, Mr. Chairman. Thank you, guys.
The gentlelady yields. Votes have been called. We will recess the hearing and reconvene 10 minutes after the last vote. The subcommittee now stands in recess.
So in that case, Mr.
The committee will now come to order. The chair now recognizes the chairman of the entire committee. Oh, I'm sorry, Mr. Tonko for his Mr. Tonko from New York, as soon as we let him get seated, from New York for his 5 minutes of questioning.
Thank you, Mr. Chair, and sorry to be a little delayed here. Let me be clear. We all support rooting out fraud, but that's not what has been happening under this Trump administration. Instead, today, Republicans are attempting to use fraud claims to legitimize the Trump administration's lawlessness in American cities. While the resulting harm might be unprecedented, this strategy is not new. This whole Congress, Republicans have levied massively overbroad allegations of fraud to justify their deeply unpopular policies. Republicans have stretched the word fraud beyond recognition. One way they have done so is by conflating things that routine administrative errors or improper payments with illegal and deceptive behavior. Professor Tillipman, can you walk us through the difference between improper payments and fraud, please?
Yes, and thank you for the question. Improper payments, all fraudulent payments are improper, but not all improper payments are fraudulent. And in fact, when we see the data points, if you have over $90 billion of improper payments, about 77% of that is administrative error and not actual intentional fraud.
Thank you for that. And in your testimony, you shared that treating improper payments as fraud, quote, distorts reality. Why is it important for Congress to treat improper payments as distinct from illegal fraud? And what are the consequences of not treating the two separately?
One of the biggest consequences is that labels drive remedies. So if you label everything as fraud and you don't make the distinction, you'll be directing scarce resources towards the wrong conduct.
And one consequence of distorting claims of fraud in Medicare and Medicaid is that it undermines the public's belief in the integrity of federal programs. How can using the term fraud as a catch-all mislead the public? And why is that so damaging for public confidence in government programs?
So again, ultimately, you want to make sure you are crystal clear with the labels that you're using, because if the taxpayers are led to believe that 100% of their taxpayer dollars are going towards fraud, it causes them to lose confidence and faith in the government operations.
And Professor, you also shared that oversight of federal programs must remain credible and durable across administrations, and that failures can diminish public confidence in oversight findings. How can instability at agencies responsible for monitoring fraud undermine the public's confidence in the integrity of government programs, and why is that indeed harmful?
Ultimately, we want to see stability in how federal programs are being operated because it makes them credible, it makes them more capable, and it also ensures that they have the capacity to adequately address these issues. If taxpayers believe that some of these things have been disrupted, that again would cause the belief that them to lose confidence in their government operations and the spending of taxpayer dollars.
I thank you for that. I thank all of our witnesses. We need to ensure that the public does not lose confidence in the ability of federal programs to help them and their families. Obviously, these programs are rooted in a sense of mission, that they are there to serve people truly in need. And if we're to destroy that by lack of confidence or other dynamics, we in fact have lost the battle to do well to the program. That means preserving the mechanisms that ensure good governance and making certain that fraud allegations are indeed levied accurately and responsibly. With that, Mr. Chair, I yield back.
The gentleman yields. The chair now recognizes the chairman of the entire committee, Mr. Guthrie, for his 5 minutes of questioning.
Thank you. Wow, I'm just sitting here trying to think we're splitting hairs over the word fraud when what's going on in Minnesota, what's going on in Los Angeles. Gosh, if that doesn't undermine confidence in the system, nothing else does. And do we not call it fraud because it might undermine confidence in the system? It's $14 billion being taken, people identity being stolen on Medicare or seniors. So when they go to get the product that they desire, that they deserve, they can't get it because somebody's gotten paid for it under their name. I mean, my goodness, we're going to try to redefine the word fraud and not include that. I'm not sure what while we're sitting here. It's just dumbfounded. So Ms. Kaye, the things that you've seen that we're talking about in Minneapolis, that's happened in Minnesota, and what happened in Los Angeles, would you define that as fraud? Aren't these people purposely setting up fake accounts so they can get money and not serving anyone? I think that would have to be fraud. I don't think that's improper.
Interestingly, so I can never, we don't use the F word often is what I say in my line of work because I'm not law enforcement or, can't, speak for the law. However, it is hard not to see fraud when there's very clear intent. Proving that intent is often what is difficult.
Okay. So Ms. Wootton, your organization, you have people that are police, you have your law enforcement. So what would you define what you're seeing in Minneapolis and what we've seen with the Somali population particularly, and in Los Angeles with domestic medical equipment? Would you define that as fraud, or is there some kind of law school term we need to use to try not to people fraud when they're being fraudulent?
Yeah, given that the information I have about those states is what I've read in the news, it's difficult to address those exact investigations. However, Medicaid fraud control units look at fraud, and we call it fraud. We do not have authority to look at waste and abuse. We are specifically designated. People refer to us a case, and they say, here's a credible allegation of fraud. Or we data mine and find what appears to be an outlier. We only pursue investigations if we think they're credible. But we do learn from other states. And yes, the schemes that we see there, we see schemes in our own states where it's definitely fraud. Companies, like I said before, set up with the sole purpose of committing fraud. Substance use disorder providers who never had a real provider provide services, even though they're so desperately needed. But I think in this conversation, we're fortunate that we focus on fraud, we call it fraud, we prosecute and litigate fraud.
So it's fair. I had a physician one time show me that he had Medicaid money or Medicare money reclaimed because he didn't put the time down. He did the service, although he did the service, just didn't have the paperwork. Absolutely correct. That's not what we're talking about. That's absolutely not what we're talking about here, is it?
Absolutely. I get
We're
that
talking about foreign entities in some cases setting up dummy accounts to take money out of the Medicaid and Medicare system, which seems like everybody in this room would want to get rid of because it takes money away from people who really deserve it. And I understand why we're splitting hairs on a definition when we have this kind of crime going on. So would you like to talk about, Ms. Kaye, too, as well, people setting up these entities just to take money from the taxpayers?
Yes, and I'd want to say absolutely. We do see some of the fraud you're describing. We also see domestic individuals stepping in who are not appropriate. They're not providers, and they're billing Medicaid and Medicare. So we see it across the gamut. But yes, it harms the system.
So how do they set up systems to get money if they're not providing care?
So they use.
I asked that rhetorically because I know they do it. So what are they doing?
Okay, so they set up a company. You don't necessarily have to be a healthcare provider to own a company, home health agency, substance use disorder clinic, nursing home. And then and some of the people at the lower level are doing what they think they're supposed to do as services. But the reality is those lower level people don't know what the Medicaid regulations are and the Medicare regulations are. And so the people who are supposed to be billing and knowing the process and who signed the provider agreements, there are no therapists involved in some of these behavioral health schemes.
So if you're billing for therapy and you don't have therapists, would that be fraud?
Absolutely is fraud.
Ms. Kaye, would you agree that would be fraud?
Absolutely.
So what are you seeing? I mean, it looks like that's what this hearing's turned into, trying to define what fraud is. And I think fraud should be prosecuted.
Absolutely. And so our role, most of the work that I do is directly for the MCOs and MA plans, and they work then with law enforcement to refer these and to get the official stamp of the fraud.
Do you see more fraud in states and Medicaid particularly that don't have MCOs or Medicaid managed? If it's just bill for service, Medicaid or Medicare, do you see more fraud in that versus when the private insurance market is trying to chase
I see a lot of MCO fraud. a lot.
across all of
Yeah, and not the plans committing the fraud. Let me be clear. But we see a lot in the states that we're working with. That is through the managed care organizations. And the difficulty to stop those. But it is many of the cases that we are working now are with law enforcement and are being prosecuted for such things.
Thank you. Well, I see my time's expired. So thank you for your time. Appreciate it.
Gentleman yields. The chair now recognizes the ranking member of the committee, Mr. Pallone, for his 5 minutes of questioning.
Thank you, Mr. Chairman. The terror and violence we're witnessing in Minneapolis is the extreme result of congressional Republicans' unwillingness to hold the Trump administration accountable, and the use of fraud as a justification for every cut to programs is really getting old. Today's hearing is yet another attempt by Republicans to convince the public that they're generally concerned about fraud, even though they've been silent. While the very individuals responsible for fighting fraud were fired, pushed out, or resigned in protest. But let me go to Ms. Tillipman. You say in your testimony that overstating fraud has the potential to, quote, stigmatize program participants. Could you talk about the risk to programs and program participants when fraud is overstated or action against fraud is taken preemptively?
Yes, thank you for the question. First, I also want to just be clear. There is definitely a lot of fraud out there. But the reason that we want to be clear about our labels, again, because different things have different consequences. Fraud can result in imprisonment. False Claims Act can result in substantial liability financially. And then, of course, some of the other types of things, including improper payment, should have greater resources than being directed to oversee those processes to result in fewer improper payments. So the risk to that and the risk to the integrity of the entire system happens when we're not appropriately directing the appropriate remedies to the appropriate act.
And then when fraud is exaggerated or overstated, how might that impact the efforts of investigators and prosecutors who are trying to root out actual illegal fraud?
So again, we have finite and scarce resources within the federal government, state governments, and of course, all the actors across the entire landscape. And so you want to make sure you're being efficient with taxpayer dollars and how you're directing those resources.
And then, well, thank you. But in the case of Minnesota, the Trump administration is withholding as much as billions of dollars in funding that the state relies on to provide health care to residents, and it appears poised to take similar action in many other states. They're doing that despite the numerous improvements that Minnesota has been implementing to prevent and prosecute fraud across the board. And this is only going to end up hurting Americans who need care. Already, the White House has directed federal agencies to review nearly all federal funding for 14 states and D.C. that supported Vice President Harris in the 2024 presidential election. So, Ms. Tillipman, again, what are effective approaches that can be taken to prevent and prosecute fraud without unfairly punishing Americans who rely on those programs?
Ultimately, what you want to do is look at things from an institutional level. We know that fraud occurs in all 50 states and then the territories as well. And so the goal is to make sure that we're not seeing what's behind us. We're so focused on some aspects that we don't look at the entire system as a whole. So that would be critical, is to make sure we're accounting for all of these risk areas, which, by the way, are in all states, so that, again, we're not misdirecting resources.
Well, thank you. Ms. Wootton, in your testimony, you refer to federal, state, and local partnerships as vital. Could you talk about how partnerships and collaboration rather than hostility between federal and state partners could help fight fraud? It's about a minute and a half yet left.
Okay, I can speak to partnerships. They're invaluable. And examples would be, as fraudsters are no longer staying within one state, they're crossing state lines. We have limited jurisdiction as a state prosecutor, state investigator, and we rely on those federal partners, whether it's the FBI's Healthcare Task Force, whether it's the HHS-OIG. They are able to take what we can provide, the resources we have, but they can also cross state lines, and we can involve other states in that. So they are critical. State partners are invaluable in the area of patient safety and protection, because they are the ones who get complaints of abuse, neglect, and exploitation. And we work those cases as well, more at the state level.
Well, thank you. I just think we're at a dangerous moment in our country. The committee Republicans are amplifying the Trump administration's reckless rhetoric targeting Minnesota and Los Angeles. And I don't think fraud is a partisan issue. It just doesn't happen in blue states. We should all want to go after actual fraudsters. However, using the facade of fraud prevention as a weapon to hurt people who did not vote for President Trump is really unconscionable. And the Trump administration must be held accountable, and the Republican majority should not be providing the administration with excuses for harming even more Americans, in my opinion. But I yield back, Mr. Chairman.
The gentleman yields. The chair now recognizes Mr. Allen for his 5 minutes of questioning.
Thank you, Chair Joyce, for holding this important hearing on fraud in Medicare and Medicaid. I think the witnesses are being here to testify. It's critical we examine how bad actors use Medicare and Medicaid to manipulate the system, and that it has negative impacts for beneficiaries and taxpayers alike. My hope is we can look for solutions on how to prevent this in the future. Mr. Nuckolls, as an accountable care organization, you're incentivized to lower health care costs for Medicare patients. What impact do fraudulent claims have on an ACO's ability to make health care more affordable for seniors?
Thank you, Representative Allen, for that question. So as an accountable care organization, we are responsible for the costs. Medicare shares with us the claims that they pay on behalf of our patients that are assigned to us by the program. So if our spending overshoots the budget, we have to pay Medicare back. And the current program we are 100% at risk. So we talk about the risk and harm to the taxpayers. In this case, the risk and harm is to provider groups like us that are trying to do the right thing. We're trying to, give higher quality care, and we're trying to reduce wasteful spending. We work within our community to do that. And so if these fraudulent claims are paid out and we don't have control over it, we report it to the federal government, more of us are going to leave the program. We've been able to reduce costs in our community by 25% over a group from where we were in the past compared to the counterfactual. If these claims keep going out and we're held accountable for claims for fraud over which we have no control, then we'll have no choice but to leave the program, and costs for the overall entitlement programs are going to go up. And so we want to keep those costs low. Thank you.
Okay, great. Thank you. Ms. Wootton, from my understanding, it's not for fraudsters to target Medicaid to commit fraud to take advantage of vulnerable populations, such as the homeless or those with substance abuse disorders. How does Medicaid fraud harm these patient populations?
In so many ways, it's difficult for many of the patients in those populations to seek services for what can be a very difficult diagnosis to let people know that you're truly an addict. And when they don't receive the services they need, not only is Medicaid wasting money paying for them, but that person still needs the treatment at the end of that. So it becomes neglect as well. So it's a very difficult population to work with. And we have difficult laws federally that make it difficult to get some of the medical records without jumping through hoops. But we need to, because this population needs to be treated.
Good. Thank you. Ms. Kaye, in your experience, can fraud be prevented if the government and regulators lowered information barriers and increased scrutiny on certain providers?
Absolutely. Yeah, I think there's a gap in our credentialing process across the board as far as letting practitioners into programs and keeping up with the screening. It's a big job, but most organizations that I work with, they are screening their providers once every 3 years, and that's just not often enough to deter the bad players out there.
Mm-hmm. Well, obviously, we have news coming out on this every day, and the public is really discouraged about the way people are using these programs in a fraudulent and abusive way. So we've got to get to the bottom of it, and I thank you for your work, and certainly Congress needs to help you in any way we can. Thank you, and I yield back.
The gentleman yields. The chair now recognizes the gentleman from Texas, Mr. Crenshaw, for his 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you, everyone, for being here. Ms. Kaye, when we talk about Medicare and Medicaid, we're not talking about just paperwork errors, right? We're talking about really actual people being harmed, whether those are seniors, kids, or the disabled. In your experience, when it comes to fraud in federal healthcare programs, it's not a victimless crime, is it? It directly harms beneficiaries. So just drawing on your experience across Medicare, Medicaid, and the commercial plans, why is it that Medicare and Medicaid are so much more vulnerable to fraud than private insurance? Look, fraud is a crime, also waste. I like to differentiate between these two terms.
Sure.
But both. Yeah.
Yeah, I mean, I think one, there's just scope and span. Medicaid in particular is difficult because each plan has varying regulations and guidance, as well as benefit coverage determination. So it gets more difficult at the state level. There's a saying, if you've worked for one Medicaid plan, you've worked for one Medicaid plan. And so that certainly offers some challenges there. I think there's also, I don't know, personally, I can say I don't often read my EOBs, but I think, that goes down too in certain populations where whether they don't have access to a computer, they don't even mail these EOBs out. We talked a little about the homeless population. Where would that go? I'm not exactly sure. So do you even know what's being billed under your Medicaid or your Medicare number? It's just a difficult process to wrap around. It's complicated from a data standpoint.
Yeah, and I think that the more we waste on people who really are not even eligible for it in the first place, the less space there is for people it's designed for. That doesn't get said enough. And that gets to my next question. I mean, who really bears the brunt of the harm? Is it the system? I mean, yeah, a little bit, right? Because the taxpayers are on the hook, so the system is hurt. But it's really the patient, for all the reasons we just stated, right?
Absolutely.
Can their care become delayed, or we've heard of providers just won't even take Medicaid anymore. Now, so what's the solution here? I mean, some argue stronger oversight would actually threaten access to care. But based on your experience, what actually happens when fraud is not controlled? And that gets to, again, who bears the brunt of this?
Yeah, I mean, I think there's certainly the patient harm attribute. You mentioned, not getting the care that you need, and Ms. Wootton brought up, SUD treatment facilities. And we dealt with some cases with ACA enrollments. And by the time we verified with CMS that those were eligible recipients, the health plan was already on the hook for $1, $2, $3 million. Were these patients even receiving the care? In some cases, yes. In other cases, they had no idea that they were in a facility for such treatment. And I think to Ms. Wootton's point with having that stigma, now you have somebody that doesn't even have that challenge, but that is now on their record. And even worse, those that do, that are getting subpar treatment at a very exorbitant rate and still not getting better.
Yeah, I mean, this gets to in my time left. Asking what the solutions are. I mean, how do you tackle fraud, waste, and abuse in a way that helps the patients and the taxpayer? I guess anybody can answer that question. Maybe Ms. Wootton, since given your role in the National Association of State Medicaid Fraud Control, like what are some of the worst, two questions? What are some of the worst examples you've seen? And then again, like how do we fix this? And that goes to anybody.
I think one example I would use as a nurse that was most shocking to me was hospice fraud. You have individuals who need this care at the end of life that is so valuable, but we see hospice schemes where patients are enrolled. They may be in a facility enrolled. They don't even know they're put on hospice. But hospice is not just a billed service. Hospice declares that they are terminally ill. It discontinues the treatments they need for preventative care. And if they don't even know they're on hospice, essentially their healthcare plan has been changed just because somebody's trying to defraud Medicaid. That is, in my mind, the most egregious. But I worry a lot about nursing homes right now because as we're all aging, especially me, the facilities are not operating in a way that verifies that patients are going to get, or residents in that situation are going to get the care they need. And it becomes terrifying because people need care. We need patients to feel safe going to their providers, and most providers are amazing. But we've got to be able to share these schemes so that somebody knows what's being billed on their behalf. And I think in Medicaid, not having explanations of benefits makes it very difficult for them to be part of the conversation and solution.
So an explanation, I'm out of time, but an explanation of benefits seems like a solution, kind of rabbit hole that we should dive into at a later point. Thank you.
The gentleman yields. The chair now recognizes a gentlewoman from Texas, Ms. Fletcher, for her 5 minutes of questioning.
Well, thank you, Chairman Joyce and Ranking Member Clark, for holding today's hearing. Thank you to our witnesses for your time today. Like many of my colleagues, I'm also in 2 hearings at the same time, but I appreciate you being here and to follow along with several of the things I've heard, which I want to get into in just a minute. But I do want to note that this subcommittee has an important job. And our purpose on the Oversight and Investigation Subcommittee is to protect our communities, to protect the rights of our citizens, and to make sure that what we see in the executive branch and beyond is not overreaching and certainly is not violating the rights of Americans. And I think it's fair to say, in face of the lawlessness that we are seeing across the country right now, that this Congress as a whole has failed to conduct necessary oversight over the last year, ceding Congress's authority to the executive branch and rubber stamping the president's agenda, even when it's unlawful and even when it's unconstitutional. And I'm concerned from some of the comments that I've heard from this hearing already today, as I've been following it, that this hearing is designed to support the Trump administration's claims of fraud in state programs, including Medicaid and Medicare, to recklessly deploy ICE agents to cities and states to cut necessary funding and to make fraud prevention and detection more difficult rather than less difficult. There's a lot to say there. There's a lot going on, but we have limited time. So certainly I understand that the Medicaid system in states and the Medicare system are not without real challenges, substantive challenges, and that there is opportunity for real fraud to occur. And certainly we know that it has occurred. In administration after administration, there have been professionals whose sole job it is to monitor, oversee, and root out fraud and abuse, to prosecute cases against those who are committing it. And what we've seen is that early on in this administration, the Trump administration fired most of those people who are responsible for doing this work. So we know that to detect this fraud, we really need experts in the field. We need responsible, nonpartisan investigations, and that's just not happening in this administration, and it's not happening in this Congress. We have limited time, of course, and I do want to get to a couple of questions for Ms. Tillipman. In your testimony, you mentioned the risk of resource management or mismanagement when we don't have reliable data to look at, when the incidents of fraud as it is defined are inflated. And so can you just talk a little bit more about how it leads to a misuse of resources, and so that you can have just a long time to answer sort of the second part of like, how does that interfere with our job here in terms of proper oversight and reform, and what are the things that we should be thinking about, looking at, and asking for so that we can properly utilize resources and properly conduct oversight?
Thank you for the question. So, ultimately, oversight is only going to function well if it is, independent, well-resourced, highly capable, and then there's a coordinated effort amongst all the individuals that are responsible for rooting out fraud, waste, and abuse in the system. So that's the baseline expectation. The loss of data is everything. I think you've heard this already from several of the other witnesses today, that data quality is a problem, and that's actually been something that's been highlighted by both the IG and GAO routinely. So that's an issue that needs to be addressed. And the final thing I'll say is there's a very great starting point for Congress right now, and which is all the many unimplemented GAO and IG recommendations. And so when necessary, even providing some sort of timeline to the agencies for completing some of those unimplemented recommendations. And so there's a whole long list, but there's an easy place for people to start, and it's written down and available right now.
Well, thank you. I think that's extremely helpful, and we have limited time here. So the other thing I want to ask is, one of the things we saw at the very beginning of this administration last year was the efforts from Elon Musk and others to go through and cut personnel. Can you talk, with the 15 seconds we have left, about how those recommendations from GAO can be implemented if we're firing the people who are responsible for doing the work?
So certainly, I think most of us can all get behind the idea of efficiency, but ideally, when we're dealing with oversight processes, we want to make strategic and more targeted cuts. And so since a lot of this was through buyouts, RIFs, and other mechanisms, incentivized retirements, I think if it's not as targeted as it could be, that necessarily doesn't reach the efficiency we would hope when we're dealing with employment issues in the federal government.
Well, thank you so much. I've gone over my time. Mr. Chairman, I yield back.
Gentlelady yields. The chair now recognizes the gentleman from Alabama, Mr. Palmer, for his 5 minutes of questioning.
Thank you, Mr. Chairman. This is something that I've worked on almost from the first day in Congress on the Budget Committee, working to get the Budget Committee to include in the budget accounting for improper payments and the reduction of that. I just looked at a report that indicates that the GAO says that the fraud could be between 233 to 521 billion annually. And that's a stunning number, considering that we budget on 10-year windows, that you're talking 2.3 trillion to 5.2 trillion plus interest, because we're operating in deficit. We're borrowing that money to send it out improperly, and in some cases fraudulently, as we're seeing played out in states like Minnesota and California and other places. One of the things on the Medicare side and the Medicaid side that should be, in my opinion, fairly easy to address, and that is the failure to verify eligibility. That's one of the biggest reasons that payments are going out fraudulently. Director Wootton, is that something you think that we can fix?
So as I mentioned earlier, the Medicaid fraud control units only have authority to pursue for provider fraud and fraud committed in collusion with the recipient. But we do partner when we have cases that involve that collusion. We work with the recipient fraud and try to solve that angle as well. But our primary focus is on provider fraud.
Would that include making sure that terminated Medicaid providers no longer enrolled in multiple Medicaid programs across state lines?
Absolutely. And a lot of that work is done through various state program integrity units, where they're looking for waste, abuse, and whether or not they have a case to refer for fraud. So those efforts are going on, and they're critical.
How about authorizing state auditors to access personal data like taxpayer identification numbers to eliminate duplicative enrollments in Medicaid?
There needs to be a system to identify duplication for sure, whether it's Medicaid numbers or other numbers, but for sure that needs to be done. And nobody benefits when fraud is committed or when money is wasted.
Well, I do think, and I think we would have bipartisan agreement on this, that Congress could do a whole lot more in writing our laws and the guidance much better to help states ensure that they can manage the money without as much fraud and waste. One of the other things that I've been focused on, and I've had many discussions with Gene Dodaro, the Comptroller General, about this, is antiquated data systems. We have federal agencies that their data systems are so antiquated they don't communicate. That is another source of improper payments. What would you suggest on that?
I would suggest that we need to find a way to be able to use all of the data as we're investigating and deciding whether fraud has occurred. An example of that, if a provider has submitted claims for services that exceed a 24-hour day, we call that an impossible day. But often we're limited to the Medicaid data we can get from our own states, and then we work with HHS OIG to get Medicare claims data, and that makes the day even more suspicious. But there's got to come a day where we can be able to use third-party payers and private payers, because those impossible days would just be so blatant, nobody would question that it's fraud.
Well, one of the suggestions been made is for the Treasury Department that operates that Do Not Pay Business Center, for them to be able to do their prepayment verification Medicaid and assist reducing the improper payments and fraudulent activities, and to have some way to collaborate with the states on that. I don't know if the states have access or the training necessary to use a resource like the do not pay system.
Right, and maybe access is even the bigger issue. We have separate systems. We do the best we can with personnel to tie those systems together. But I think, as I said, any time that we could have more access and more education on tools that would help us all combat fraud, it would be invaluable.
We need to do audits on a more regular basis. And one of the suggestions I made to General Dodaro is that rather than be punitive in our actions toward agencies with high improper payment rates, that maybe we think about if they can reduce their improper payment rate, that we use the savings to bring their data systems in the 21st century, which is kind of a novel idea. I yield back.
The gentleman yields. The chair now recognizes a gentlelady from Massachusetts, Ms. Trahan, for her 5 minutes of questioning.
Thank you, Mr. Chair, and thank you to the witnesses today. I have to say there is a perverse irony in today's hearing. Republicans tout their big bill as a fraud crackdown while President Trump quietly pardons major Medicare and nursing home fraudsters involving tens of millions of dollars stolen from taxpayers. Look, no one disputes that fraud, waste, and abuse exists in our healthcare system. We see it in Medicare Advantage, where insurers upcode diagnoses that don't exist to inflate payments and pad shareholder profits at taxpayer expense. But when it comes to the real fraudsters, this administration has granted impunity. Last May, President Trump granted clemency to Lawrence Duran, who stole $87 million from Medicare. In November, the president pardoned a nursing home operator after just 3 months of a 3-year sentence, despite stealing from taxpayers while neglecting elderly residents in his care. Professor Tillipman, what message is sent to fraudsters when the President of the United States pardons people convicted of serious Medicare and Medicaid fraud?
Thank you for your. Well, I can't speak to any particular case. I can simply say that one of the features of enforcement is the importance of deterrence. And so certainly when individuals are considering whether or not they're going to commit fraud, they will look to whether or not the government is actively enforcing its laws, and they will look to some of these cases, and it might be a factor in deciding whether or not the system could be credible or reliable. But again, I wouldn't speak to a specific case.
Thank you. I appreciate you stating the obvious. This claim that Republicans are serious about fighting fraud just doesn't appear to hold up in practice. The big ugly bill doesn't target fraud. It cuts healthcare for Americans while delivering tax breaks to the wealthiest in our country. Instead of going after large-scale fraud schemes, Republicans impose complex work reporting requirements that force states to build costly new infrastructures. The Government Accountability Office has found states spending anywhere from $10 million to more than $270 million just to set up and run these systems. In Georgia, when the state imposed these red tape requirements on its residents, more than 80% of spending went to administration and system upgrades rather than patient care, with enrollment falling and little to no impact on employment. And the real winners, I think, are clear. I mean, just days after the bill was signed into law, the CEO of Equifax publicly celebrated it as a profit opportunity. While eligible patients face new paperwork barriers, private data vendors stand to make millions administering requirements we already know don't work. Professor Tillipman, rather than investing in fraud enforcement, Medicaid work requirements rely heavily on private companies to build and run verification systems. What oversight risks does this pose when the rules are vague and taxpayer dollars are flowing to contractors with limited public accountability?
Well, I think ultimately the whole goal of an entirely effective oversight system is to prioritize your money by risk. And that works not only for the federal government or state governments, but also private entities who make risk-based decisions. So ultimately, I would recommend to anybody looking on how to reform a system to look where your biggest risks are and then focus your enforcement attention activity there.
That seems logical. And, we've run this experiment. Work reporting requirements haven't reduced fraud. They haven't meaningfully increased employment, and they've drained millions into administrative systems instead of care. If the goal is actually protecting taxpayer dollars, what guardrails would work without pushing eligible people off of their coverage?
So I think looking at it from an institutional perspective, again, I think one of the recommendations I had was the many unimplemented recommendations by GAO and the IG. One of the bigger areas we see, and especially what's been touched upon today with MCOs, is the diffuse responsibility and ensuring that when weaknesses are identified, like lack of referrals or lack of feedback loops or lack of training at the state and local level, that we follow up on those recommendations to address some of those weak points within the system.
Thank you. I yield back.
The gentlelady yields. The chair now recognizes the vice chairman of the committee, Mr. Balderson, for his 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you all for being here today. My first question is for Mr. Nuckolls. Are Medicare and Medicaid beneficiaries provided with clear, actionable information on how to detect and report suspected fraud?
Not by organizations like us, but it is available, online if they were to go to the right websites.
Okay, what information can be shared with them that would allow for better detection and reporting of suspected fraud?
I think in my experience that Medicare beneficiaries have done a good job reporting fraud when they see it. The real question is what happens after they report it and see it, and the actions that take place or don't take place.
Thank you. Next question is for Ms. Kaye. My understanding is the timeline from the moment fraud occurs until it is identified and resolved is far too long. How long does it typically take for a fraud examiner to identify suspected fraud in a post-payment review?
We see an average case take about a year. By the time we do conduct the data analysis, your investigation, conduct member surveys, request records, review those records, and then give the appropriate appeal timeframe, it's usually between 9 months and a year before we have really credible allegations of fraud, at which point we can pull in our law enforcement partners. It can happen sooner than that. In a great case, sometimes it is as soon as we get it, it is glaring. Other times it takes even longer as we try and peel back the networks of who owns what and what is connected.
That's kind of what I was going to follow up with. How long does it take to then investigate the identified fraud?
Once it's identified as fraud, that goes to law enforcement and I back off.
Thank you. My next question is for Ms. Wootton. As the leader of the state Medicaid fraud control unit, how quickly are you able to identify the instances of fraud? And then a follow-up would be, and how successful are these units at recovering fraudulent payments once they have gone out the door?
The speed of an investigation and a prosecution depend on many issues. And if say a patient calls in and they say, my provider did not see me and I found out they billed, that can go very quickly if we're just looking at one provider. In the scheme that I described in my written testimony with behavioral health, we don't want to just get the one patient, one provider situation. We're trying to find out, are there related companies? How high in the organization does it go? Because that's where the true fraud and a lot of money is there. Those can take a long time. And I'm sorry, will you repeat the second question?
Yeah, I can. And how successful are these units at recovering fraudulent payments once they have gone out the door?
So we, of course, diligently try. Unfortunately, some of these fraudsters have spent the money or the money has gone elsewhere and it's difficult to track. But we work closely with our single state agencies, our Medicaid programs, to let them know that if we no longer need, say, a law enforcement exception for payment suspension, if we think we're going to do some kind of an operation that could be jeopardized if the provider becomes aware of the investigation, then we ask them to give us a little time to do that. But once the provider's aware we're looking at them or we've done everything we need to do, we can notify the Medicaid program that we no longer need that exception. And if they can suspend payments, those payments can come in much better. We can get much more back.
Thank you. Well done. Follow up to also Mrs. Wootton. Are fraudsters using emerging technology such as artificial intelligence to deal with these Medicaid fraud schemes?
Yes, we see that evidence across the nation, and we've been bringing in speakers on that topic to try to educate us. It's frightening as you watch presentations on how quickly an MRI or an X-ray can be altered, and we need to be able to determine which is the correct one. So we're trying to combat fraud with tools, but we need more tools.
It's a great point. And I mean, I will ask you, are you all doing anything to adapt to figuring out this AI piece and the fraudulent with that?
Yes, it varies by state how much we've been able to use it, but these presentations are showing us how we could use them to look at medical records and at least identify that they're cookie cutter records, that every patient there has the same diagnosis, same treatment. And I think that will be able to be done sooner rather than later. But we may, we're going to have more resources to be able to combat fraud where they're altering images or falsifying surgeries or that kind of a thing. But our association, like I said, is committed to learning this. And we've been bringing in speakers for about the last 3 years.
Thank you very much, Mr. Chairman. I yield back.
The gentleman yields. The chair now recognizes the gentlelady from Washington, Dr. Schreier, for her 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you, Madam Ranking Member, and thank you to all the witnesses for being here today and for your work. I'm really happy that this committee is taking on the issue of fraud, an issue that we all want to crack down on. Fraud and abuse hurts patients, honest providers, as we've heard a lot today, and the taxpayer, and this is not a partisan issue. But right now, fraud is being weaponized by this administration only against blue states. I'm sure you have noticed. It is being used as a pretext for cutting funding to 14 states, all of which happen to be run by Democrats. Criminals should be prosecuted whether they are in red states or blue states, and we have heard over and over again in this hearing from all of you that it happens everywhere. It happens in red and blue states. And so I just want to say that I'm tired of the weaponization. I am ready to work with my Republican colleagues on common sense ways to improve oversight so that we can truly root out fraud everywhere. But other than when it's politically convenient, this administration's also made it harder to investigate Medicare and Medicaid fraud. Just 4 days into his presidency, President Trump illegally fired 18 inspectors general, as we've talked about. These are the very people responsible for rooting out fraud and abuse in federal programs, and they are independent, nonpartisan officials. And President Trump fired them in favor of his highly political and highly ineffective DOJ, which slash programs indiscriminately. And one of the IGs that he fired was the highly respected, highly experienced HHS Inspector General, who oversaw and was in the process of doing a lot of crackdowns on this type of fraud. And then, of course, about a year later, he was replaced by Thomas Bell, who himself has a very concerning history of misuse of taxpayer dollars. This is hardly the right man for the job. So if we want to root out fraud, I suggest for this committee that a great place to start is Medicare Advantage, because that is where a lot of the really big dollars are being wasted. Medicare Advantage is a type of Medicare plan that contracts with private insurance companies, as you know, to deliver care. This is a public-private partnership that was initially championed by Republicans as a great way to use the private market to save money, to administer healthcare, they thought, more efficiently. But it turns out it just has not saved Americans money. It allows massive insurance companies like United Health Group to swindle the taxpayers by making their patients look sicker than they actually are so that they can make more money per patient, and we taxpayers end up footing the bill. In fact, a 2024 Inspector General report found that taxpayers spend billions of dollars in overpayments to Medicare Advantage companies each year based on unsupported diagnoses for MA enrollees. That was a quote. Professor Tillipman, thank you for being here today. And I really appreciate your comments on the record of enforcement of rules being a great deterrent for other fraud. I think that's an important lesson, and also a very obvious lesson for anybody in here who is a parent. What specifically more do you think HHS could be doing to strengthen accountability for managed care plans like Medicare Advantage?
Thank you for your question. Again, I feel like I've said this a few times, there are some unimplemented recommendations from the GAO and IG that relate to that plan in particular. There's a long list. You can go online. They have actually a tracker that identifies them, but I think would be the most useful in terms of oversight. There is one thing I will raise, though, particularly because so much of the recoveries from this year's False Claims Act were related to healthcare, and a big priority has been managed care from FCA enforcement. Right now, there's an 11th Circuit case on appeal challenging the constitutionality of the key TAM components of the False Claims Act, which is a huge driver, $5.3 billion of these False Claims Act recoveries. So Congress, it would behoove Congress to pay close attention to the outcome, because if the key TAM relator whistleblower provisions and incentives go away, I think we're going to see significantly reduced anti-fraud, or not anti-fraud, but False Claims Act activity.
I really appreciate those comments. I will keep a very close eye on that case. It sounds like it will have gigantic ramifications. Thank you. I'll yield back.
The gentlelady yields. The chair now recognizes the gentleman from Georgia, Mr. Carter, for his 5 minutes of questioning.
Thank you, Mr. Chairman, and thank all of you for being here. I'll preface my remarks by telling you that professionally I'm a pharmacist, and I have dealt with hospices in my career. In fact, one of my businesses was entirely dedicated to hospices and nursing homes and personal care homes. So I've got a lot of knowledge, a lot of experience. And I will tell you, during the 90s, I serviced the only hospice in Savannah, Georgia. And it seemed like overnight they proliferated and exploded. And all of a sudden we had 12 and 13 and 14 and 15. And I always wondered what happened there. How did this happen? Now, I'm not saying that they were all committing fraud, but what I am saying is that they called on to the fact that they could make a lot of money. And we saw the proliferation of it. And I'm concerned about what's happening. What I've heard is happening, particularly in California, where the state auditors have reported an unprecedented surge in home health and hospice fraud. My wife's a physical therapist, and she worked home health as well. So this is why I ask, and I appreciate you letting me wave on to this committee, Mr. Chairman. So this is why I'm very interested in this. But in a shocking example, auditors found that 112 hospice providers operating out of a single physical address. 112. Holy cow. As a result, hospice agencies in LA County alone likely overbilled Medicare by $105 million in just 1 year. Let me tell you, there's a special place in hell for people who commit fraud with hospice. Special place. This is something we've got to look at. And it looks like it's not just an isolated problem. It looks like it's a problem in a lot of different places. And that's why I want to ask you, Ms. Wootton, have you seen instances of copycats where fraudsters see a successful fraud scheme happening in one location, so they try to replicate it, the same fraud elsewhere?
Absolutely. We definitely see replicated fraud schemes, and hospice is an excellent example. I share your concerns about home health and hospice because I owned a home health agency for many years. And I didn't even choose to be a hospice because there were specialized agencies that could handle that part, and we would refer to them under the right circumstances. What we now see, though, hospices who are admitting patients who are not terminally ill, patients who don't know they were put on hospice, patients who maybe aren't getting treatments that they need because the hospice philosophy, as you know, is for comfort care, not for treating illnesses. So in our state, we have seen the same thing. in Utah that the hospices have exploded. Now, I'm not saying they're all fraudulent either, but absolutely fraudsters learn from fraudsters, and it's an area we have to investigate.
Do you share this information with other states whenever you find out that there's, a certain scheme going on?
Absolutely. That is the value of NAMFUCU, our national association. All 50 states and the 3 territories work together to share schemes. And we talk more openly than I think we had to even several years ago, because we need to know who are these people and how do we get on top of it? How do we collaborate? We teach training programs. Right now, we have a group over at our main office who are preparing on nursing home fraud, and they're creating a curriculum to teach MAFUCUs how to identify that fraud.
I'm telling you, special place in hell for these people.
Yeah.
Let me shift gears here. I want to talk about something else that I'm interested in. That's skin substitute pricing and cost. Over the past 2 years alone, Medicare Part B expenditures for skin substitutes have skyrocketed from roughly $400 million in 2022 to more than $10 billion. Hear me. $400 million in 2022 to more than $10 billion with a B in 2024. That's a staggering 640%. Again, they see this happening, man, like buzzards just coming together. So I introduced the Skin Substitute Access and Reform Act, and this targets runaway pricing and inappropriate prescribing through program integrity reforms that target the top 3% of providers generating nearly 2/3 of the Medicare skin substitute billing, with program integrity reforms and setting a payment rate at a sustainable level that protects patient access. I'm concerned, and Mr. Nuckolls, I'm going to ask you this one. I'm concerned that the approach of setting a very low payment rate without specifically targeting problematic providers may be harming patients. From your perspective, does an artificially low reimbursement rate risk restricting access for legitimate patients and providers?
Thank you very much for the question, Representative Carter. From where I sit on the business side of things, I can tell you that that no one will give skin substitutes. Patients will not receive skin substitutes based on the current regulations that were passed by the Secretary and the HHS.
That's what
I
I'm
couldn't
hearing
tell you
from
whether
these
it's comparable or better than existing treatments. You would have to ask a physician.
We don't want to swing that pendulum too far. I mean, we got to correct it, but you got to be careful not to swing it too far. So would a more targeted program integrity approach be a better way to do it?
I don't know that I'm qualified to say that, because I don't know. I know the current program will cease almost all skin substitutes from being
exactly. And see, again, I don't want that to happen, and I don't think anybody wants it to happen. We ought to be targeting those bad actors and how we can get to them. Thank you, Mr. Chairman, again for letting me sign on to this, and thank y'all for being here. And I yield back.
The gentleman yields. The chair now recognizes the gentleman from California, Mr. Mullen, for his 5 minutes of questioning.
Thank you, Mr. Chair. Thank you all for being here today. At face value, fraud in government programs is an important topic for this subcommittee to consider. We have a responsibility to ensure federal programs under our jurisdiction are being implemented as intended by Congress, and that federal dollars are going to communities that need assistance. However, we cannot discuss healthcare fraud without discussing the deeply troubling actions by this administration in the name of addressing fraud. The Trump administration has deployed ICE agents to Minnesota under the guise of at least partially addressing Medicaid fraud. We have all seen with our own eyes that this mission is leading to the killing of American citizens and terrorizing innocent families. But what has the majority on this committee chosen to do? While American citizens are being executed by their own government on American soil, they open an investigation on Minnesota's Medicaid program. Ms. Wootton, CMS has specified in its comprehensive Medicaid integrity plan that individual states are empowered to best address program integrity challenges, with CMS supporting. And yet the federal government is attempting to take the lead on fraud allegations in Minnesota out of nowhere. Ms. Wootton, do you believe we can get better outcomes in Medicaid fraud investigations and enforcement actions when local, state, and federal agencies closely collaborate? And why would that be the case?
That collaboration is critical because fraudsters are not just in one state doing one particular fraud. They travel from state to state, and the states don't have the tools to cross state boundaries. We don't have authority to prosecute or investigate in those states. We collaborate closely with federal partners. They are integrally involved with us. In fact, HHS OIG pays 75% of everything we do so we can collaborate. So we need to put all the tools we possibly can in this toolbox to combat fraud. That would include state, federal, and local partners.
I do appreciate that. In your experience leading fraud investigations, could you tell us, does the Department of Homeland Security typically play any role in investigating Medicaid fraud?
No.
Okay. So-called fraud is also being used by this administration as a catch-all excuse to cut healthcare spending and punish states that didn't vote for the president. In H.R. 1, the Republicans' big ugly bill, they cut $1 trillion in healthcare spending to supposedly address waste, fraud, and abuse. But when you look past their messaging, this bill is stripping 15 million Americans of their healthcare coverage and giving a tax break to corporations and billionaires. There are also countless examples of this administration freezing or canceling federal dollars for political reasons. Just a month ago, the Department of Health and Human Services froze childcare and family assistance grants going to 5 states with Democratic governors, including my home state, California. They claim it was to ensure program integrity and fiscal responsibility, but families relying on these programs are hurt in the process. So, Ms. Tillipman, as you highlighted in your testimony, fraud on some level is inevitable, but well-resourced oversight can successfully detect and address widespread issues. So my question is unilaterally freezing billions of dollars in assistance a smart, targeted way to address fraud, especially when it comes at the expense of ripping essential health services away from beneficiaries? And what are some more effective approaches?
Thank you for your question. I haven't examined those specific states, particularly in preparation for this hearing, but I will say this. Ultimately, once you are completely shutting down programs, whether it's cutting off contractors from their access to contracts, shutting down spending in certain areas in a kind of blanket way, it may be able to stop any type of fraud, but it could also harm innocent individuals as well. And so what we typically would say is you'd want to have a response that's proportional to what you're detecting. And while I wouldn't be able to say without examining those particular states what that is, generally when we see either fully excluding from a program, completely ceasing funding something, or again, kicking certain contractors or companies out of a system, usually that is the nuclear option. And so ultimately, again, I usually like to recommend a scalpel instead of a sledgehammer.
Thank you for that. I just want to wrap by saying I'm deeply concerned about the weaponization of allegations of fraud to enact a political agenda. And I know that my colleagues on this side of the aisle and I will not stop calling out that hypocrisy. And Mr. Chair, I appreciate the time and I yield back.
The gentleman yields. Seeing there are no further members wishing to ask questions, I would like to thank our witnesses again for being here today. I ask unanimous consent to insert in the record the documents included on the staff hearing documents list. Without objection, so ordered. Pursuant to committee rules, I remind members that they have 10 business days to submit additional questions for the record. I ask the witnesses submit their response within 10 business days upon receipt of the questions. Members should submit their questions by the close of business on Wednesday, February 18th. Without objection, the subcommittee is adjourned.
Ladies and gentlemen, the President of the United States, Donald J. Trump.
Thank you very much. Thank you. This is a big deal. This is a very big deal. People are going to save a lot of money and be healthy. So we're here this evening to celebrate the launch of one of the most transformative healthcare initiatives of all time. There's never been anything like it. Starting tonight, dozens of the most commonly used prescription drugs will be available at dramatic discounts for all consumers throughout a new website. It's called TrumpRx.gov. That's TrumpRx.gov. For years, politicians from both parties have promised to bring down prescription drug prices and make healthcare more affordable, but they all failed. It was all words as usual. They failed, and they failed badly. They tried doing this. Some of them, most of them didn't even try because they never really had a shot at it. But I'm actually getting it done, and it is done, actually. This launch represents the largest reduction in prescription drug prices in history by many, many times, and it's not even close. You're going to see numbers that you're not going to believe. Americans have long been paying the highest drug prices anywhere in the world, while other countries often paid pennies on the dollar for the exact same drugs. We were essentially subsidizing the entire world and subsidizing by hundreds of billions of dollars every year. The United States is just 4% of the world's population and consumes only 13% of all prescription drugs, yet pharmaceutical companies have been making 75% from these drugs. Think of it, 75% of the money they made came from the United States, with a smaller population than what we will call the world. The American people were effectively subsidizing the cost of drugs for the entire world, and it's not going to happen any longer. We ended it. Everybody knew it was unfair for 30 years, but nobody did anything about it. Under the most favored nation agreements my administration has negotiated, the United States will pay the lowest price paid by any other country. So we're taking the lowest price paid for drugs. We will pay equal to whatever the lowest price anywhere in the world That's the price that you're going to be paying. It's a tremendous reduction. Drug prices in other nations will go up by doing this. They had to agree. And the reason they agreed is I used tariffs. I said, if you don't put them up, then we're going to put tariffs on your nation, which will be more expensive to you. So in many cases, the drug costs will go up by double and even triple for them, but they're going way down for the United States, come all the way down by a difference of as much as 300, 400, 500, even 600%, even more than that in some cases. For example, you will see dramatic reductions in the cost of popular weight loss drugs known as GLP-1s. GLP-1s. Novo Nordisk will be slashing the price, as an example, of Ozempic from more than $1,000 to $199. And the price of Wegovy from more than $1,300 to $199. Nobody can even believe it. A 578% difference. Eli Lilly, who's been very helpful to us in getting this done, will be cutting the cost of its common insulin, drug, and medication from $200 to $25. Nobody can believe it. $200 to $25. AstraZeneca is slashing the price of a common inhaler from $458 to $51, a difference of nearly 800%. And we're also delivering historic discounts for couples struggling with infertility, as EMD Serrano will dramatically cut the cost of its most common IVF drugs. For example, a single dose of the most common IVF drug in the country, Gonal F, will plummet from the highest price in the developed world that we paid. The United States was subsidizing everybody. We paid the highest to the lowest price in the world, which will be demonstrating very shortly. We have some very talented people coming up and showing you how it's going to work and how the website works. All of these discounts and more will be available directly to consumers starting today at trumprx.gov. In just a moment, we will demonstrate how you can go to the website, get a coupon, and pick up your heavily discounted prescription drugs, highest level drugs, the highest level company, finest in the world, biggest in the world, most powerful drug companies in the world. And we had to go through them, and then we had to get all of these countries worldwide to lower their prices, and for us, help us lower our price. And what they did is, again, their prices went up by double, triple, and even sometimes 4 and 5 times. But the dozens of commonly used drugs available today are just the beginning. 16 of the 17 largest pharmaceutical companies have signed agreements, and the other one is coming. Believe me, they're coming. Committing that going forward, all new medicines they bring to the market in the United States will be available at most favored nation prices. For those that don't know, that means in the entire world, most favored, we get the most favored, the lowest price. So if somebody gets a great price, it's great for us because we get it. So this is the exact opposite of what's been happening for the last 30 plus years. This policy, which is a key pillar of the great healthcare plan, is going to bring copays plummeting down and save Americans billions and billions of dollars, making healthcare much more affordable, like at a level that you couldn't believe. In my first administration, I kept drugs pretty even. I thought I was doing a great job, but this is really the great job. There's never been anything like it. Nobody thought it was possible to get it done. It's the biggest thing to happen in healthcare, I think, in many, many decades. Under these agreements, the top pharmaceutical companies will also be investing hundreds of billions of dollars to bring drug manufacturing back to America. It's already happening. They're building plants all over the country. Eli Lilly is building 6 plants with billions and billions of dollars each, which means jobs, economic growth, factory openings, and far greater national security. And it's really a big factor was the tariffs. We're charging very substantial tariffs for companies that don't want to make their drugs or pharmaceuticals and automobiles and other things. If they don't want to make them in the United States, they have to pay very big penalties in the form of tariffs. And what that means is they're all coming here. Every industry is coming here. We're taking in more than $18 trillion into the United States because of tariffs. The companies, the only way they can avoid them is to build here. They avoid paying the tariff. Now, they've been doing that, countries, to us for 30 years. That's how we lost so much business. They were drying up our country. We were losing factories. We were losing jobs like nobody's ever seen for many, many years. And now it's all been reversed, and we've never had a period. This is the wealthiest our country has ever been. We have hundreds of billions of dollars a year pouring in, and we're taking advantage of it. I want to give a special thanks to Airbnb co-founder and now, much more importantly, the Chief Design Officer of the United States, Joe Gebbia, and the entire team at the National Design Studio. They're unbelievably talented people. This group of geniuses could be doing anything right now. They could have been making a big fortune out there, but they decided they want to be with the government and do exactly what you're going to see tonight, and also some other things having to do with our country. And I want to thank Joe With their help, our American by Design initiative will fully transform our most dated federal systems and services, providing Americans the richest, most beautiful, and most user-friendly government experience in the entire world. We have the greatest designers in the entire world, and they're with our country. They love our country. That's why they're doing it. So now I'd like to invite Administrator of the Centers for Medicare and Medicaid Services, an incredible guy, a really brilliant man, Dr. Mehmet Oz, to show us how this beautiful new website works. And Dr. Oz, come on and let's see what you can tell us. Thank you, by the way, everybody. You're going to save a fortune. And this is also so good for overall healthcare. And Oz, you've done a fantastic job. Thank you very much.
Thank you, sir. So you demanded, President demanded, that we have most favored nation drug pricing, which he explained beautifully. Today, you can now get access to these discounted, steeply discounted prices. All the hard work the president and the administration have done now is yours, but you have to go check trumprx.gov. So if you have access, please log on right now. It's free. You get to look at all the prices, and you should not be buying drugs anymore going forward without at least checking to see if those medications are available at these discounted prices on trumprx.gov. That stated, Mr. President, many people don't appreciate this, but one of the most special things you've been able to do, besides negotiating these kinds of deals, is bring wonderful people around you who can actually fulfill the dream of making drugs accessible so Americans no longer suffer that affordability issue. 1 in 3 Americans are turned away from the drugstore. They can't afford the drugs. No more. Our most vulnerable are protected. To do that, you need brilliant software engineers. And Ed Korstein led a wonderful group that you hired. Folks, again, would never normally come to government to work to make this possible. And Joe, just a superstar, and he's going to take us through the website.
Thanks, Dr. Oz. Mr. President, I've launched some big websites, and this is one I think you're going to be very proud of. So you mentioned Gonal-f. I think this is an interesting drug that we can check and see how do you find a drug on the site. So we'll pull up the website here. This is trumprx.gov. And I'm going to start at the search bar where I can search by the drug name. So I type in Gonal-f, and I see it autocompletes. When I click on this, I have a beautiful page that shows the drug product. And right at the top, I see this is 83% off the original price. Now, how do I get this discount? I take this coupon and I bring it to the pharmacy. I can print it out. I can add it to my wallet on my phone, whether it's an Apple or an Android. I show it to the pharmacist and I get the coupon credit right at the register. Now, this is an intelligent site. We know that there's other drugs that are commonly prescribed along with this. So we surface them here and they work with the same coupon. Okay, next, what pharmacies can you go to get this drug? It's a smart site. We pull up exactly where you can go to get this. Now, Gonal-f is a specialty drug, so you get it through the mail. I can call any one of these pharmacies and they deliver it straight to my home. It's that simple.
Mr. President, 1 in 3 families is having trouble having a baby. We're going to have a lot of Trump babies with these costs. Folks cannot afford these medications. It's going to change their lives. Now, this is the tip of the iceberg because Joe did a lot more with Ed and the rest of the National Design Studio. How many more medications do you have?
Well, the website launches with over 40 medications, ones that are the popular medications and ones that were previously very expensive. These are things like asthma inhalers, the GLP-1s. And on TrumpRx, you can actually find things like the weight loss shots and also new form factors like the weight loss pill. Let's click on this and see the discount for the pill. 89% off the original price. As you mentioned, Americans for the first time are getting the lowest cost price drugs like the rest of the world is. And we're not done. We're adding more and more drugs week over week. So going forward, it's an invitation to the nation to check trumprx.gov anytime you get a prescription.
Mr. President, we're breaking news. This weight loss shot that you've talked about a lot, this is a weight loss pill. And with these pills, which are actually even less expensive than the shots, we project that America will lose about 100 million pounds this year, which is going to make not only folks a lot healthier, but a lot easier to manage when they do get ill. But I'm particularly drawn, as I know you are, to the plight of folks, young couples trying to have children. And that first medication, one of the first ones we did most favored nation drug pricing on, has helped an immense number of folks. But the first person to use trumprx.gov to buy Gonal-f is here. And I wanted to introduce her to you, if you don't mind. Catherine's with us. Oh, perfect. Secretary Kennedy's going to escort her.
Good evening. I'm incredibly honored to be here tonight. I'm a military spouse, and my husband and I have been navigating infertility and IVF for 5 years, a journey that has included profound loss. Through that experience, we have come to understand how critical access to affordable fertility medication truly is. Medications like Gonal-f and access to them have been essential to our treatment and to our hope of success. IVF demands extraordinary physical and emotional strength. But for so many families, the financial burden can be just as heavy and at times overwhelming. The President's leadership on price transparency and on reducing the cost of medications, some of which are essential in my fertility treatments, has a real and immediate impact. Families like ours, it can mean the difference between being able to continue treatment or having no choice but to stop. These efforts help ensure that IVF remains within reach for families who are doing everything that they can to build a future. Families who should not have to choose between financial stability and the chance to have a child. For that commitment and leadership, we are greatly thankful. Thank you.
Thank you very much. Well, Oz and everybody, I want to thank you for the job. Joe, what a job you do. Bobby is back here, who is so instrumental. He's doing such a fantastic job. Who would have thought of Kennedy? We love the Kennedy, the Republican Party, but there's been no better advocate for what we're doing than Bobby Kennedy Jr. So I just want to leave you with this. You're going to save tremendous amounts of money. Go to the site. We have many of them, and in a very short period of time, we'll have just about all of them, and they'll be available for differences of 5, 6, 700%, even in some cases more than that. We're tired of subsidizing the world. We have to put America first. If you think about it, that's exactly what we're doing. We want to take care of everybody, but we have to put America first. So this is going to have a huge impact on healthcare. No matter which plan they come up with, drugs and prescription drugs, they form a big part. And now you're going to be getting those drugs at numbers, not with a 1 or 2 or 10% discount, but think of it, 80%, 90% in some cases, numbers that nobody's even thought possible. So I just want to thank our entire team. They have so many people here that have worked so hard. And again, Joe and Oz and Bobby, thank you very much. Great job. And congratulations to you and all that money you're saving. Okay. Thank you. Thank you very much, everybody. Appreciate it. Thank you. Thank you very much.
Good afternoon and beyond. There are few crimes more morally repugnant than stealing from vulnerable children. Every dollar stolen is a meal not eaten, a doctor's visit missed, and a future diminished. Child welfare fraud plunders our children's potential and erodes our nation's future. And disturbingly, at the start of this new year, America has learned that this kind of looting was not occurring in some distant or lawless place, but in the heart of America's Midwest. Federal prosecutors in Minnesota now estimate that half or more of the $18 billion spent since 2018 across 14 Minnesota welfare programs may have been lost to fraud. If confirmed, the amount stolen would rank among the largest welfare frauds in American history. In Minnesota, a welfare system designed to uplift the most vulnerable children was treated like an open ATM, exploiting both taxpayers and the public trust extended to immigrant communities. Over the last decade, Minnesota Democrats didn't just fail to stop the fraud. They made it easy and profitable, and in a totally lawless fashion, silenced anyone who pointed it out. Taken together, the record shows that the fraud was not accidental or unforeseeable, but was the product of deliberate inaction, willful blindness, and calculated abuse. Today, we will proceed in three parts. First, we will show that Minnesota was clearly warned by journalists, by auditors, and by its own independent oversight bodies, and that the state responded by passing laws and promulgating safeguards intending to stop this abuse. Secondly, we will examine how Minnesota's Democrat leadership deliberately turned a blind eye, failed to enforce those safeguards, and in some cases retaliated against those who tried to sound the alarm. And third, we will explain how the fraud actually took place, the mechanics by which these schemes operated, and the very real harms they inflicted, not only on taxpayers, but on vulnerable children and on law-abiding Somali families whose trusts and identities were exploited. First, Minnesota was warned. Let me be clear about one foundational fact. Minnesota was not caught unaware. Minnesota was warned repeatedly, unmistakably, and years in advance. This fraud did not arrive suddenly. It did not emerge from an unforeseen loophole, and it did not occur without notice. As far back as 2010, the Milwaukee Journal-Sentinel exposed widespread child care fraud across the upper Midwest in a Pulitzer Prize-winning investigation that sent a clear warning to regulators, providers, and the child care industry as a whole. Without strong oversight and verification, fraud would flourish. Minnesota was on notice. Nearly a decade later, those warnings were no longer journalistic. Now, they were official. In 2019, the Minnesota Office of the Legislative Auditor issued a formal report examining Minnesota's Child Care Assistant Program, the CCAP. The Legislative Auditor identified serious deficiencies in oversight, including inadequate attendance verification, weak financial controls, fragmented enforcement, and an over-reliance on provider self-reporting. The auditor warned plainly that these conditions created a high risk of fraud. Critically, the auditor estimated that approximately $100 million Child Care Assistant Programs funds had already been lost to fraud. Minnesota Democrats responded, but not out of vigilance, out of political necessity. The report landed just months after they won their new majority in the state legislature in the 2018 elections. Faced with a damning audit and mounting political pressure, Democrats acted, on paper at least. Following the 2019 report, the legislature amended CCAP statutes and promulgated new enforcement policies designed to close precisely the gaps the auditor had identified. By 2019, Minnesota had the warnings, the audit findings, and a panoply of legal authorities to detect, stop, suspend, and prosecute fraud. But that brings us to the second part of the story. Democrat leadership ignored the law they had just passed, attacked whistleblowers, and failed to enforce it. Once Minnesota had been warned, and once Minnesota Democrats wrote the solution into law, the duty was clear: enforce the law. Instead, they treated legislation as a press release, not a mandate, providing political cover while allowing the money to keep flowing. Federal audits later confirmed what internal staff had warned all along. Minnesota failed to verify attendance, failed to use its suspension authority, and failed to intervene early when red flags appeared. What's worse, rather than go after the fraudsters, the state went after the whistleblowers. On January 31st, 2026, the Minnesota Star Tribune reported that staff at the Minnesota Department of Human Services repeatedly flagged fraud risks and lax safeguards, only to have those concerns ignored, dismissed, or met with retaliation. According to that reporting, current and former DHS employees sent an anonymous letter to the U.S. House Committee on Oversight and Accountability, describing serious and systemic failures dating back to at least 2019. Employees reported being reassigned, called racist and xenophobic, sidelined, excluded from key discussions, and in some cases, subjected to what they described as threats or workplace surveillance after raising red flags. Minnesota's Democrat leaders did not reward integrity. Instead, they punished it. When bipartisan legislation was introduced to establish an independent inspector general, Minnesota Democrats blocked it. The Democrat House Speaker at the time explained why. An inspector general, quote, is not part of the budget framework, citing an $18 million cost over 4 years. As billions were being pilfered by fraud and as whistleblowers were being silenced and punished, Minnesota Democrats had the gall to say that an inspector general costing only $4.5 million a year was too expensive. That wasn't fiscal prudence, that was a choice. It was willful blindness. The programs move billions of dollars each year, and they're concentrated within a relatively small number of administrative pipelines. Minnesota's Somali community receives welfare benefits at rates far higher than the state average, making these programs both financially significant and politically sensitive. In a state where the closest statewide elections were decided by less than 1%, the Somali community votes overwhelmingly Democrat. The numbers are stark. 81% of Somali households in Minnesota receive some form of welfare, 81%, compared to 21% of non-Somali households. 54% of Somali households receive food stamps compared to 7% of non-Somali households. 73% are enrolled in Medicaid compared to 18% of non-Somali households. And 27% receive cash assistance compared to 6% of non-Somali households. In December 2025, Minneapolis resident David Hoke, who's here today, accompanied by journalist Nick Shirley, visited child care centers, autism clinics, and healthcare facilities across Minneapolis. They went on a Tuesday, not a Saturday, not a holiday, not in the middle of the night. Tuesday during the day. What they found? Blacked out windows, misspelled or non-existent signage. I will say we will always remember the Leering Center that promoted good leering. Multiple, quote, providers registered to the same address and no kids present. It's amazing having child care centers and autism centers with no kids. And by the way, it's not subtle. You walk up, there's no toys, there's no kids, and the windows are blacked out. This is not hidden. It is obvious, except for the Democrats that didn't want to see it. Had the state done its job, had it sent inspectors instead of press releases, that fraud would have been obvious. To understand just how calculated this fraud became, consider the most disturbing example of all. In September 2025, federal prosecutors charged Asha Farhan Hassan for orchestrating a $14 million fraud scheme against Minnesota's EIDBI autism program. The program exists to provide medically necessary early and intensive care to children with autism. Fraudsters turned it into a profit engine. According to the charges, Hassan and her partners recruited children from the Somali community, paid parents cash kickbacks, used unqualified individuals as quote-unquote therapists, and billed Medicaid for services never provided or grossly inflated. Where a child did not already have an autism diagnosis, the scheme allegedly worked to obtain one. In other words, there was no child they could not qualify because the diagnosis itself became the means to an end. According to the University of Minnesota, 1 in 12 8-year-old Somali children in Minnesota was diagnosed with autism, compared with 1 in 28 non-Somali children statewide. In Minnesota, Somali children are 7 times more likely than their non-Somali peers to receive autism quote-unquote treatment. These figures show extraordinary concentration and extraordinary billing, the precise conditions fraudsters exploit. And here's the deepest human cost. Telling an immigrant child that he has autism, not because he does, but because someone wants to get paid. Imagine the weight of that diagnosis on parents who may not speak English fluently, who trust authority, who believe the government would never lie about their child's health. That label can follow a child for life, shaping education, self-image, and opportunity. Doing that for financial enrichment is not merely fraud, it is the deliberate exploitation of children and the calculated betrayal of parents. And once fraud proceeds are laundered and sent overseas, in 2023, the Somali diaspora sent nearly $2 billion back to Somalia. Once they're sent overseas, they're effectively unrecoverable. Meanwhile, Al-Shabaab, the U.S. designated foreign terrorist organization and Al-Qaeda's affiliate in Somalia, controls large swaths of territory and systematically extorts money moving through its financial channels. When billions of dollars are stolen from U.S. welfare programs and sent abroad, there is no credible way to ensure those funds do not enrich jihadists within Al-Shabaab. As one confidential source told the Manhattan Institute, the largest funder of Al-Shabaab, a Islamist terrorist organization in Somalia, is the Minnesota taxpayer. Listen to that again. The single largest funder of Al-Shabaab, a terrorist organization in Somalia, is the taxpayers of Minnesota. Taken together, the evidence before this committee leads to one unavoidable conclusion. Minnesota was warned. Minnesota's Democrat leadership failed to enforce the laws it passed, and that failure allowed organized fraud to flourish, harming children, betraying families, and robbing the public of trust and resources. This hearing is necessary because Minnesota's elected Democrats were complicit in this fraud. They stood to benefit politically from looking the other way as fraudsters robbed the taxpayers of Minnesota. Look at the bench of witnesses. To this hearing, I invited Governor Tim Walz. He's not here. I invited Attorney General Ellison. He's not here. I invited Mayor Fry and Tiki Brown, the commissioner of the Minnesota Department of Children, Youth, and Families. Not one of them agreed to testify and defend his or her conduct. They are hiding out after having served as the lookout in a bank robbery that was robbing the taxpayers of Minnesota. The people of Minnesota and the American people deserve better. And not a one of these Democrats has given any credible excuse why they're terrified to answer questions. I now recognize the ranking member.
What a strange thing it is to have a hearing about Minnesota that doesn't address what's on the front pages of every newspaper about Minnesota. The violent and unwelcome federal occupation of its largest city by the chairman's political party, an occupation that has already caused the deaths at federal agents' hands of 2 American citizens and left many more injured, and that is roundly criticized by law enforcement leaders, including those in Texas, as unprofessional and dangerous. That may explain why elected officials in Minnesota have something better to do today. No mention today of 100 violations by agents there of federal court orders. No mention of the sacking of the vain little commander of that operation. No mention of the venomous lies told by Secretary Noem about the shooting victims without investigation or sympathy, as their bereaved families grappled with grief at their deaths. I've done law enforcement briefings, and rule one is to tell the truth. What a strange thing it is to have a hearing about fraud in Minnesota that doesn't acknowledge that the wide-ranging investigation and prosecutions of $9 billion worth of fraud in that state began years ago under the Biden administration. No mention of the fact that the current administration drove out the career prosecutor leading those cases when it demanded he investigate the victim of an ICE shooting, not the agent who did the shooting. 14 prosecutors have left the Minnesota U.S. Attorney's Office in the past month. And what a strange thing it is to have a hearing about fraud that doesn't look at the colossal fraud perpetrated by this administration, starting with the president's own conviction of 34 felony fraud counts, the dismissal of inspectors general who watch out for fraud, the destruction of the Justice Department components that prevent and prosecute corruption, the self-serving billion-dollar crypto deals that line the pockets of the president and his family, the pay-to-play presidential pardons that strip fraud victims of their restitution, the disabling of consumer protection offices and regulators that defend the public against fraud. It is a carnival of fraud and self-dealing. On top of all this, the biggest fraud ever perpetrated in America is going on right now, facilitated and accelerated by the Trump administration and implemented through a massive, semi-covert climate denial fraud operation and a twinned, massive, semi-covert, dark money political corruption operation. This fraud costs Americans hundreds of billions of dollars every year, $770 billion annually, according to the International Monetary Fund, $820 billion annually in healthcare costs from another report. Climate-related disasters cost the United States $115 billion last year. How was this fraud done? This long-running fraud operation began when oil industry scientists reported to their bosses the dangers of fossil fuel pollution, and instead of responsible stewardship, the bosses hid the reports. That was stage one. Stage two moved from hiding to purposefully misleading. A federal court shut down Big Tobacco's fraud operation to mislead the public about the dangers of tobacco. That tobacco fraud operation was quickly repurposed by Big Oil into its own fraud operation to mislead the public about the dangers of its product. Stage three kicked off with Citizens United, which gave the fossil fuel industry the ability to spend unlimited amounts of political money and spend it secretly. This dark money political corruption operation swiftly strangled bipartisanship on climate. Before stage 3, there were multiple bipartisan climate bills in the Senate, and John McCain ran for president on a legitimate climate platform. All of that was killed by fossil fuel dark money. Now we're in the most dangerous stage where the corruption is so entrenched that the fossil fuel industry can infiltrate and weaponize the federal government as its own industry tool to defeat energy competitors whose product is cleaner, safer, and cheaper. But no Republican dares talk about that problem any longer. Such is the party's dependence on those big fossil fuel donors. President Trump asked the fossil fuel companies for a $1 billion campaign slush fund in 2024, and they expect and got a return on their investment. Quid pro quo. The lies and fraud are legion, but to use just one Rhode Island-based example, senior cabinet officials continually assert that offshore wind is unaffordable when the opposite is true. Anyone reading the contract can see that Revolution Wind will bring 9.9 cent kilowatt hours to an 18 cent kilowatt hour grid. The administration's weaponized attacks, rejected as pretextual, went 0 for 5 in federal court, including before a Trump appointee. Instead of focusing on this massive fraud or holding the administration accountable for the monumental levels of fraud and corruption in its own ranks, a Texas chairman holds a hearing on fraud in Minnesota, which is neither the biggest issue in Minnesota nor the biggest example of fraud. There's a biblical saying about the mote in another's eye and the beam in your own from the Sermon on the Mount. Why beholdest thou the mote that is in thy brother's eye, but considerest not the beam that is in thine own? Asked Jesus. I will leave it at that.
I want to commend my Democrat colleagues in an ode to Homer Simpson. When something is distracting, scream, squirrel! Because we saw a speech about global warming. We saw a speech about Orange Man Bad. We saw a speech about how today's Democrat Party exists seemingly exclusively to defend violent criminal illegal aliens and to demonize law enforcement. And yet, miraculously, in that enormous word cloud, virtually nothing about $9 billion stolen from Minnesota taxpayers by Somali fraudsters, with Democrat politicians knowing full well what is happening, facilitating it, and harvesting votes and campaign dollars from the people robbing the children of Minnesota. My Democrat colleagues want you desperately not to focus on those facts. And so instead, miraculously, the Democrats have discovered the Sermon on the Mount. Well, this hearing is going to focus on $9 billion stolen from the taxpayers, and hundreds of millions of those dollars going to the Al-Shabaab terrorist organization funded by the Democrats. As much as my colleagues on that side of the aisle don't want to talk about it. With that, I recognize the chairman of the full committee, Chairman Grassley.
Senator Cruz, thank you for chairing this important subcommittee hearing. And I want to point out an association with your emphasis in your remarks about the importance of whistleblowers and inspectors generals rooting out and exposing fraud. I'll speak about that a little bit, but not as strongly as you have. And I want to say that I appreciate your bringing that up. During my time in the Senate, I've exposed waste, fraud, and abuse within many government programs. At the end of last year, the American people learned of shocking and sophisticated fraud schemes in Minnesota. Billions of taxpayers' dollars may have been lost to crime. What happened in Minnesota is as bad as it gets. These fraud schemes have targeted federal programs designed to help children with autism, the elderly, and small businesses. It's deplorable that actors would target programs designed to help Americans struggling to take care of their children and their families. It's also deplorable that the Walz administration allegedly retaliated against whistleblowers who tried to expose this fraud. If true, such retaliation should not go unpunished. In large-scale fraud schemes like these, whistleblowers are public's greatest asset and allies. Congress, federal agencies, and state agencies must protect whistleblowers, and the executive branch must hold criminals fully accountable to the law. That's why in January, I wrote to nearly 10 agencies, including the Department of Justice and the FBI, regarding the allegations. This is all about accountability. I want to know what the government's doing to solve these problems, hold wrongdoers accountable, and take steps to ensure this never happens again. Director Patel announced in December 2025 that the FBI deployed personnel and investigative resources to Minnesota. Attorney General Bondi has ordered additional Department of Justice prosecutors to Minnesota. And on January the 8th, the Trump administration announced the creation of a new division for national fraud enforcement within the Department of Justice. This new division will focus on rooting out fraud across the federal government. and will be led by a new Assistant Attorney General. The Treasury Department's introduced additional reporting requirement for banks and other financial institutions in Minnesota. These new requirements are designed to alert regulators to suspicious overseas transfer of cash. Regarding these financial oversight efforts, Secretary Bessent recently stated, quote, Minnesota is going to be the genesis of a national rollout. A national approach is needed now more than ever. The Department of Education has also reportedly begun creating a dedicated fraud detection team and has already prevented $1 billion in student aid fraud since January 2025. I expect the administration to provide the committee with updates regarding these efforts. However, as the title of this hearing suggests, allegations of fraud have extended beyond Minnesota to other states. Fraudsters are operating on a national scale, affecting federal programs from Medicaid to student aid and beyond. The federal government and state governments, whether Republican or Democrat, are in charge, must always respect the taxpayers and their monies. The same is true of the Inspector General community. Federal and state agencies across the country must work together to get to the bottom of these sophisticated fraud schemes. This should not be a partisan issue. Senator Cruz, thank you again for holding this hearing.
Thank you, Mr. Chairman. I now recognize the ranking member of the full committee.
Thank you, Mr. Chairman. This is the subcommittee's second hearing this year. Last month, we had to listen to my Republican colleagues push for the impeachment of federal judges who had the nerve to rule against the Trump administration. Today's hearing marks another low. In the last month, federal agents shot and killed 2 of our fellow Americans in Minnesota. Bystanders and journalists have documented numerous abuses of constitutional rights by federal agents in Minneapolis, including warrantless arrest, use of excessive force, racial profiling, surveillance of protesters, and the detention of U.S. citizens and children. This abuse of power and much needed oversight of the Trump administration should be the focus of this subcommittee because of the individuals involved in what they've done. Somewhere along the way, many of my Republican colleagues decided they could tolerate the scenes of agents shooting innocent American citizens. But the timely topic to them is fraud by one immigrant group in that same state. As part of their ongoing need to carry water for the president, they have chosen to embrace his bigoted attacks on Somali immigrants, whom he has called garbage. The shameful title of today's hearing reflects that same approach. I want to be clear. Fraud is a crime and it should be prosecuted accordingly. In fact, it was the Biden Justice Department that opened the Minnesota fraud investigation and brought the first prosecution. And it is the Trump Justice Department that has diverted prosecutors and FBI agents away from fraud investigations to focus on the president's mass deportation campaign and his effort to establish some sort of retribution for his political enemies. According to the Cato Institute, a conservative operation, American citizens accounted for 95% of federal welfare fraud losses from 2013 to 2024. American citizens. So to suggest that the Somali community is disproportionately responsible for fraud is just not supported by the facts, even from the Cato Institute. If we're serious about fighting fraud, let's talk about a president who has more than doubled his net worth since his return to office. Blind trust as a possibility have been replaced by eyes wide open money grab. Let's talk about senior administration officials who have misused government resources and taxpayers' dollars for personal purposes and travel. Let's talk about fraudsters who have made huge contributions to the president and been rewarded with pardons. Business executives who have committed Medicare fraud, securities fraud, wire fraud, crypto fraud, tax fraud. If we're worried about people breaking the law in Minnesota, our focus should be on the Trump administration's Department of Homeland Security. Last week, the chief federal district judge in Minnesota, a Republican appointee, noted that ICE violated 96 court orders in Minnesota in January alone, likely more than some federal agents have violated in their entire existence. But Minnesota is not the only place suffering from this cruelty of this administration. For months, the administration has targeted my home state of Illinois as part of reckless attacks they claim are law enforcement operations. In reality, they are not enforcing the law. They are breaking it with their racial profiling, detentions, threats, and use of excessive force. Last month, the administration expanded its attacks by trying to freeze billions of dollars in funding for children and families in 5 Democratic-led states. Illinois was targeted along with Minnesota, New York, California, and Colorado. Political retribution at the expense of children. The administration provided no support for their allegations that these states were improperly awarding benefits, but the explanation is obvious. This is another act of political retribution by the Trump administration. This hearing is an affront to the people of Minnesota and the memories of those who lost their lives at the hands of immigration officers. The real fraud we should be focused on is the one perpetrated by this president and his acolytes. I yield.
Thank you. I will now introduce the witnesses. The first witness we have is the Honorable Kristen Robbins, a native of Crookston, Minnesota. Kristen Robbins currently serves as the chair of the Fraud Prevention Committee in the Minnesota House of Representatives, where she works to uncover the large-scale fraud in Minnesota and to hold state agencies and fraudsters accountable. Representative Robbins is also co-chair of the bipartisan bicameral Civility Caucus, which aims to build relationships and trust across parties and between the House and Senate. Prior to joining the House in 2018, Representative Robbins co-founded and served as the executive director of the Economic Club of Minnesota, a nonprofit focused on strengthening Minnesota's economic competitiveness, and previously served on the State Commission to End Chronic Homelessness. She received her bachelor's degree in economics and political science from Bethel University and her master's degree in economics from Washington University. Our second witness is Robert Weissman, who is the co-president of Public Citizen, the consumer advocacy and pro-democracy organization. Weissman focuses on government and corporate accountability, among other issues. He is the author of The Corporate Sabotage of America's Future and the co-author of 2 other books. Previously, he worked as director of the corporate accountability organization Essential Action and as editor of the Multinational Monitor, a magazine that tracks multinational corporation. Weissman is a graduate of Harvard College and the Harvard Law School, a fact for which I hope we can forgive him. Our final witness is David Hoke. David Hoke is most well known for his role as the Minneapolis whistleblower in YouTuber Nick Shirley's video uncovering massive fraud within Minnesota's Somali community. Mr. Hoke was born and raised in Minnesota, where he attended the University of Minnesota and ran for Attorney General in 2010. As an investigator, he has devoted considerable time and resources over the last several decades to scrutinizing Minnesota's elected official and exposing corruption. He co-founded Minnesotans for Responsible Government, where he serves as a lobbyist. And we'll start now. Representative Robbins, you're recognized for your opening statement.
Thank you, Mr. Chair. Thank you for inviting me to testify as chair of the Fraud Prevention and Oversight Committee in the House. I've been working tirelessly over the past year to expose the massive fraud that Tim Walz and his administration has enabled. We've also proposed solutions and worked to hold state agencies and criminals accountable. We have a long way to go, but we are getting results. With my brief remarks, I want to highlight 3 things: how this started, where the money is going, and provide a roadmap for how states can prevent fraud and we can partner better with the federal government. First, how it started. The original fraud scandal was tied to the Child Care Assistance Program, or CCAP, which is a federal program for low-income families with children. There have been allegations of fraud in this program since 2011. By 2014 and 15, there were raids, charges, and convictions of child care providers for billing non-existent or absent children, with fraud exceeding $1 million in some cases. In March and April of 2019, just a few months into the Walz administration, the Legislative Office Auditor published 2 reports about the CCAP fraud. They outlined the fraudulent providers and the alleged movement of millions of dollars in cash out of our state to Somalia, with allegations that the money was going to fund terrorism. Unfortunately, according to multiple whistleblowers, soon after these reports were released, the Criminal Investigation Unit for Child Care Fraud, which had been leading the charge on these prosecutions, was shut down by the Department of Human Services. Rather than conducting criminal investigations of fraud, the Walz administration essentially renamed fraud as overpayment, and then referred any overpayment cases to a new internal overpayment committee, which would decide if they should pursue reimbursement. The DHS staff in this unit were no longer allowed to talk to their counterparts in the Bureau of Criminal Apprehension without prior supervisor. Failure to address child care fraud and the decision to stop criminal investigations led directly to the largest COVID fraud scandal in the nation. In March of 2020, Representative Ilhan Omar authored a bill called the Meals Act, which eventually was incorporated into a larger COVID package. This law enabled states to waive the normal eligibility requirements for participating in the National School Lunch Program, eliminating income requirements, site inspections, and expanded distribution methods. Minnesota took full advantage of these waivers and enabled site sponsors like Feeding Our Future, Partners in Quality Care, and Gargar Family Services to bill for hundreds of millions of fake meals for fake children. Just one of these groups, Feeding Our Future, became the largest COVID fraud in state and national history, bilking taxpayers of at least $250 million. To date, there have been 78 indictments and 61 convictions in the Feeding Our Future scandal, with more cases to go on trial this spring. The Feeding Our Future prosecutions then revealed that as many as half of those defendants were also getting state money in other Medicaid-funded programs. Yet despite reports on this back in 2023, more than 3 years ago, Tim Walz and his agencies didn't stop those defendants from getting additional state money in other Medicaid programs. We now have found fraud in multiple Medicaid programs, including autism centers, sober homes, non-emergency medical transportation, integrated community supports, and housing stabilization services. In December, our committee held a hearing on credible allegations of fraud in 2 new areas: adult day services and assisted living facilities. We now have seen allegations of fraud in 14 Medicaid programs. The former first U.S. attorney who led these prosecutions for years stated that the estimated fraud is $9 billion. And this doesn't count fraud in SNAP or child care programs. So where's the money going? Minnesotans pay their taxes and they expect their money to go to things that help their communities: roads, schools, healthcare, and not to be taken by criminals, to buy resorts in Kenya, apartments in Nairobi, property in Turkey, or luxury homes and cars in the U.S. Worse yet, Minnesota taxpayers have allegedly found their ways into the hands of terrorist organizations like Al-Shabaab, both directly and indirectly. The money is walking out the door at the Minneapolis-St. Paul airport. Back in 2017, the estimate was about $100 million in cash was going out annually from our airport. According to TSA, in 2024, there were $300 million in cash outbound. And in 2025, it was $350 million. This is astonishing, not only because of the amount, but because it is so out of proportion to other airports. The cash out of Minneapolis is 99% higher than cash going out of Dallas, Atlanta, and JFK in New York. It's 90% higher than what's going out of Seattle. Minnesotans are incredibly frustrated that their hard-earned money is being siphoned off by criminals while their taxes keep going up and vulnerable citizens don't get the services they need. Other states should learn from our failures. There are some basic common sense principles to stop the fraud. First, culture matters. Fraud flourishes when leaders ignore it and criminals see they can get away with it. Tim Walz has not held anyone responsible. Second, fraud flourishes when basic internal controls are not followed. This is not complicated. Third, truth matters. We cannot be cowed by charges of racism or Islamophobia, which have been successfully weaponized to limit scrutiny and fraud in Minnesota for years. This is not ancient history. It is still happening. When I testified before the House Oversight Committee on January 7th, I was stunned to be called a racist 6 times in that hearing. This is the same playbook that has been used to protect Minnesota criminals for years. Anytime a whistleblower or legislator raised questions about Somali fraud in daycares, nutrition centers, autism centers, they were called a racist or said that charges of racism would ruin their careers. So where do we go from here? State and federal partners work together. We need your help to have more audits of these programs and to enforce current laws that require states to pay back in 1 year if they have been found fraud or overpayment. We also need the federal government to require documentation, not just attestation, for eligibility in these programs. We also need more resources at the U.S. Attorney's Office and CMS to help with investigations. And finally, the federal government should have greater power of oversight and investigation of cash going out of our country. I'm thankful for the brave whistleblowers, journalists, and the federal and state partners in this committee for helping us identify fraud. We cannot allow this to continue. The time for accountability and justice is now.
Ms. Weisman.
Thank you, Senator Graham and members of the committee. Fraud and scams are indeed a scourge in America, across this country, not limited to Minnesota. Taxpayers are cheated when fraud is done against government programs. Beneficiaries are harmed as well. Fraud in the private sector steals billions from consumers, and in extreme cases, drains families of life savings and sends them into a cycle of misery. Unfortunately, the reality is the Trump administration is systematically dismantling the anti-fraud programs of the federal government. Those programs aim to deter fraud, punish wrongdoers, and bring restitution to victims. The administration is undermining all of that. It is fair to say, in fact, that through its actions, the administration is fostering more fraud, facilitating more scams, empowering corporate and small-time fraudsters alike, and depriving victims of the justice to which they are entitled. As regards Minnesota, there plainly is some fraud that has gone on, as there is throughout this country. Where there is fraud, it should be investigated and prosecuted. No one wants tougher enforcement more than legitimate providers and the beneficiaries of the programs that are being defrauded. That said, it is unhelpful to make claims about fraud in Minnesota or anywhere else based on exaggerated numbers or shaky evidence. And in the case of Minnesota, it's worth pointing out that the efforts by the U.S. Attorney are being undermined by this administration driving out the people who are engaged in the prosecution of the fraud in Minnesota and by diverting the FBI from its work on fraud to immigration enforcement. Moreover, there is no justification for suspending social service programs, vital social service programs, as we all agree, as punishment for fraud. That punishes innocent people and leaves the fraudsters alone. Nor, obviously, is there any rationale for pursuing suspension of programs on a partisan basis. Now, the subtitle of this hearing is Dealing with Fraud in Minnesota and Beyond. I wanted to pull back and talk for a few moments about the beyond. To be clear, the actions of this administration are undermining governmental, anti-fraud, and accountability agencies. When it comes to corporate fraud or scams perpetrated by those close to the administration, the policy is to ignore, forgive, or coddle the wrongdoers if they're actually caught. Moreover, the president and his top aides are shattering norms of conflict of interest and basic ethical standards, creating a culture of impunity that for sure is encouraging more fraud against the government and around the country. This is not an administration that is determined to root out fraud. In short, for the super rich and for the super connected, this is an administration that is taking the anti-fraud cops off the beat. And for those who manage to get caught anyway, they give them and are doling out get out of jail free cards. Let me explain the evidence behind this. When it comes to the Department of Justice, this administration has gutted or disbanded the public integrity section, the consumer protection portion branch of the agency. It has fired the agency's top ethics advisor. It has issued guidance to soften corporate crime enforcement. The president has pursued his pardon power in strange service of fraudsters. Leaving aside the January 6th pardon, more than 1/3 of all the president's pardons have gone to those who perpetrated fraud or similar kinds of crimes. Those pardons have led to the cancellation of $1.5 billion in fines and restitution owed, including more than $1 billion owed to victims of fraud or wrongdoing. The pardons themselves have re-victimized the victims. The president has eviscerated the system of inspectors general that the chairman was referencing earlier and for whom has done so much to advance that IG system. Not only did he fire 17 IGs at the start of his administration, he is responsible for firing 2/3 of presidentially appointed inspectors general. 3/4 of the inspectors general top offices were empty as of October. We've looked at the staffing inside the IG's offices, drastic cuts across the board. The president had shuttered the Consumer Financial Protection Bureau, illegally in our estimation, closing down the most important anti-fraud agency in the federal government. He has slashed staffing at the Internal Revenue Service by more, guaranteeing an increase in tax fraud, avoidance, and cheating, primarily by the super rich, and costing taxpayers approximately $200 billion over the next 10 years, according to Yale University analysts. He has canceled enforcement against large corporations more than 150 separate times that we've been able to document in the first year of the administration. He is engaged in rampant conflicts of interest, including most startlingly a joint venture with a UAE-affiliated company, as reported by the Wall Street Journal this past weekend, compromising our foreign policy, destroying basic ethics standards, and inviting more fraud and wrongdoing by others around the country. He has destroyed the East Wing of the White House and then solicited funds from corporations and the super rich to pay for his ballroom. Our investigations found that 2/3 of those corporations contributing had government contracts, more than $200 billion in contracts over the previous 3 years. This committee is absolutely right to focus on fraud. Senator Cruz is absolutely right to bring his righteous anger against fraud. But that fraud is not limited to Minnesota. That's small potatoes compared to what this administration is perpetrating. I encourage this committee to focus on that fraud, to pursue the reversal of the policies that I've identified, and serve the American people who absolutely, on a unified basis, want to counter fraud and wrongdoing in the government and in the private sector.
Mr. Hoke.
My name is David Hoke. I was born in Minneapolis. I'm a lifelong resident of the Twin Cities area. And although it's not in my testimony, I take exception to Mr. Weissman's questioning of my data as being inaccurate. I'll get back to that. My journey into uncovering fraud in Minnesota and ultimately throughout the entire United States, as it turns out, began when I started to notice very unusual changes in the Minneapolis area. Remember, I grew up there, so I know Minneapolis very well. Most notably, the enormous number of childcare facilities that had opened up. I would drive around the Twin Cities, and it seemed these childcare facilities were literally on every block. Some blocks had 2 or 3 childcare facilities on the same block. Minnesota sees a fair amount of snow in the winter, and I began to notice, driving by these childcare facilities, there were never any footprints in the snow outside these childcare facilities. And I go by them 3, 4, 5 times a day, Monday through Friday, because my office is in the heart of where a lot of these childcare facilities are. So I said, well, what's going on here with all these childcare facilities? So I began to check the Minnesota Secretary of State's website to find out just who owned all these childcare facilities. And guess what? Every single one of them was Somali owned. Not every childcare facility in Minnesota was, but the ones that I was looking at that were by my office, and there were a lot of them. What's even stranger is that every one of these facilities is located in a commercial or industrial building, no play areas, bad neighborhoods, and several of the childcare facilities had signage which stated they were open either 7 a.m. to 10 p.m., 2 p.m. to 10 p.m., Quality Learning Center, for example, or open 24 hours. Who the heck brings their kid to stay overnight at a childcare facility in a rough neighborhood? None of it made any sense. The Leering misspelling was the final straw for me. That's the spark that ignited my full-on investigation. So Minnesota has 2 different childcare licenses available. One covers 6 a.m. to 6 p.m., and the other one covers 6 p.m. to 6 a.m. They're 2 very different licenses. So for a childcare facility to be open 24 hours a day, or even from 2 p.m. to 10 p.m., they need both licenses. How many of these facilities that are open these extended hours have 2 licenses? None of them. 0. They all have only 1 license. Minnesota child care supervision requirements include the following. For infant care, that's 0 to 17 months of age, you have to have 1 adult supervising for every 4 children, and max 8 in a group. For toddlers, which is 18 to 23 months of age, it requires 1 adult for every 5 children to supervise, max 10 children in that group. For 2-year-olds, you need 1 adult for every 7 children, so max 14 in a group. So if a child care facility was billing the state of Minnesota for 99 children, i.e. Quality Learning Center, that child care facility would need to have at least 8 employees supervising those children. These cannot be 1099 employees. They have to be W-2 employees. That means we're going to have at least 8 W-2s, and we're going to have at least 8 I-9s. So if the feds went in and checked that, what do you think they're going to find? You already know the answer. One issue that is often brought up is that we are unfairly targeting the Somali community. This is a fair point to be made. As one Somali gentleman exclaimed in our second video, we're not the only community that does fraud. Fraud certainly exists in every community. It was the sheer volume and the blatant nature of the Somali fraud that demanded my attention. When one facility, Mako Childcare, has another childcare, mini childcare, registered at the same address, but the sign still says Mako Childcare, it kind of stands out. And again, no children, no footprints in the snow, ever. This is what I mean by being blatant. Misspelled signage, posted hours that require 2 licenses, no child footprints in the snow, not even once. So how did we arrive at this point? Why are we having this hearing? We got here because of politicians, almost exclusively Democrats. A couple of names come to mind. Jody Harpstead, the former commissioner of the Department of Human Services, and Shireen Gandhi, the current commissioner of the Minnesota Department of Human Services. Harpstead put the whole fraud on steroids. She was steering the ship from 2019 to 2025 during the COVID-19 pandemic. This is when the whole fraud network exploded into what we see nationally today and to what we see in my numbers, which are accurate. So now we hear that the Minnesota Department of Human Services is forging documents and backdating paperwork, all in an effort to cover up their complicity in this fraud. This is just more criminal behavior from the gang at the Minnesota Department of Human Services. It's criminal behavior. Minneapolis was the incubator for this nationwide fraud, which we're now seeing in Maine. We're seeing it in Washington State. We're seeing it in Columbus, Ohio. It was constructed here in Minneapolis. And the idea behind it was if you can get a population in here and fit them into this fraud framework, you have a guaranteed voting block for all eternity. The fraud was started, and then it expanded out, and now you see it all around the country. So why is fraud bad? Why is it a bad thing? Why does anybody care? Fraud is bad because it steals from the blind. It steals from kids with cancer. It steals from disabled. It steals from the homeless. It steals from wounded veterans. It steals from everybody in this room. So what is the answer? How do we fix this? The way we fix this is that the federal government has to go to the Minnesota Department of Human Services and every social service agency and say, look, if you issue a payment using federal money and it goes to a fraudulent company, you run the risk of us coming in, arresting you, handcuffing you, parading you out, bringing you in front of a judge, and putting you in prison. So if you're going to issue a payment, you better make sure that it's a legitimate company. Otherwise, don't issue the payment. Go on Google Earth. Look at it's a liquor store. It's a grocery store. Why are you issuing payment to a child care or a transportation company that doesn't even exist? Why are you issuing a payment? It's criminal behavior. The federal government has to use that cudgel over these people and say, look, you better be sure if you issue that payment that it's a legitimate payment, or you could end up in prison. Thank you.
Thank you. Before we move to questioning, I want to ask if each of the witnesses could rise so that I can administer the oath. If you would raise your right hand. Do you swear that the testimony that you're about to give before this subcommittee is the truth, the whole truth, and nothing but the truth, so help you God?
I do.
All of you have answered affirmatively. You can have a seat. And I hope your opening statements were truthful. I should have done that before your opening statements, but I guess we'll have to take your word for it. Representative Robbins, let's start with you. How broad was the fraud that was perpetrated in Minnesota?
We are still getting a handle on it, but it's all of the, not all of, but a huge segment of the childcare programs, autism services, sober homes, emergency transportation, of 14 areas of Medicaid fraud, SNAP benefits. We are still, I would say, getting whistleblower reports, uncovering new vectors of fraud. We just discovered the adult day services and the assisted living. Those haven't been counted in the total so far. So I believe it's much broader than we currently know, and we will continue to expose it.
Is there any chance the elected Democrats in charge of the state were unaware of the fraud?
No. There have been credible whistleblower allegations, press reports, and Office of Legislative Auditor reports for many years.
Mr. Hoke, I want to thank you for your citizen journalism and your hard work pressing for accountability here. I will say I watched the video that you did with rapt attention. It was profoundly effective. It was also, by the way, an indictment of all of the so-called journalists on the national level, because none of them could be bothered to actually go and investigate. I want to ask you the same questions I asked Representative Robbins. Number one, how broad do you believe the evidence shows the fraud in Minnesota was?
It's easily in excess of $30 billion when you take everything into account. You've got all of these NGOs, you've got nonprofits, you've got county money, you've got city money, you've got CCAP money, you've got another thing called Great Start. So there are all these piles of money that factor into the fraud. I don't know that anybody can ever determine an exact number, but I kept telling the U.S. attorney when he came out, he said, you got to get your number up, you got to get your number up. And he did. He kept ratcheting up the number, and I kept saying, you got to be at least at $30 billion. So going back to whether Governor Walz knew about it, Governor Walz admitted knowing about the fraud early in his first term, which would say 2020. Well, Minnesota statute 3.971 subdivision 9 clearly says that if you are made aware of fraud in a state agency, you are obligated to immediately report that fraud to the Office of the Legislative Auditor. Immediately. The Legislative Auditor is then the body that determines which law enforcement agency to bring into the investigation. Governor Walz did not contact the Office of the Legislative Auditor. He said he contacted the FBI. About what? That's not what the law says.
How many organizations receiving taxpayer funds did you visit in total?
How many?
How many organizations or ostensible organizations?
Companies, 200.
Of the child care centers you visited, how many kids did you see?
The only place that I saw children was at KinderCare and New Horizons, which are, in my opinion, legitimate. They're large scale. They have play areas. And they also receive CCAP money, but they're the only places that I saw where there were children present, ever, at any of them.
How about the autism centers? Did you see children? Did you see patients there?
Never. So that's not to say there weren't any, but there were never there. There were never any there. When I was there, never any footprints in the snow, same thing.
Mr. Weissman, you're co-president of Public Citizen, which describes itself as a consumer advocate and a pro-democracy organization. Would you agree that the fraud in Minnesota was staggering and shocking?
I agree that there is fraud in Minnesota. I don't believe these estimates are grounded in any evidence that I've seen. The $9 billion figure was based on a claim just that, well, I think that half of them must be fraudulent. I just heard a comment just saying, boost the number up. But to be clear, and with respect, you missed my testimony. No question there's fraud in Minnesota, and absolutely I share your righteous anger about whatever degree of fraud there was there.
Do you agree that any Democrat politician, or let me be clear, any Republican politician that had knowledge of the fraud and was complicit should be prosecuted?
I'm not sure what they're being prosecuted for, but also in my testimony, I described also outside of Minnesota the manifold ways that this administration is enabling fraud.
Look, I understand. The reason, hold on.
The standard is that you want
Sir, I'm going to ask a question, and then you can answer it.
Yes, sir.
Your organization describes itself as a pro-democracy organization. I'm going to try to find out if you actually are pro-democracy or if you're simply pro-Democrat and are a partisan. We've seen the Democrats who want to change the topic. So I get you want to testify how much you hate Donald Trump. But I'm quite certain Donald Trump was not running a fraudulent daycare center or a fraudulent autism center in Minnesota. So all of the talking points about how you dislike Trump, set them aside. We will see the Democrats on this committee go down those talking points. Do you believe elected politicians in Minnesota who were aware of this fraud and were complicit in it should be prosecuted? Should there be accountability?
There absolutely should be accountability. It is not normal to prosecute government officials for not prosecuting fraud. That is not a standard I'm aware of that you've advocated or that anyone else has advocated in the Senate.
So do you think it's perfectly okay?
I did not say
if let's say Governor Walz or Attorney General Ellison knew about the fraud, benefited from the fraud in terms of bundling votes, benefited from the frauds in terms of collecting campaign finance violations, and deliberately looked the other way. You think that's not criminal conduct?
In that hypothetical, it is not okay. 100% not okay. But also, if you'll permit me, that hypothetical is in fact happening throughout.
Okay, yes, I get it. You dislike Trump. I understand you dislike Trump, sir.
It is whether I have a standard of accountability.
So let me, sir, please do not interrupt me. Please do not interrupt me. Please do not interrupt me. You may answer questions after I ask them. You've heard the evidence and testimony about daycare centers with no children, with no toys, with no facilities, with windows that are blacked out. Do you believe it is possible that the officials sending millions of dollars to those fake daycare centers and fake autism centers didn't know what was going on?
Well, what I heard was claims about that, and I too have watched the video. We're both parents. I'm glad that the child care centers don't open their door for someone who's knocking there. I don't view that as evidence that the child care centers are fake child care centers, although I'm sure there are some. My understanding is that state investigators have gone to do their duty at those exact same child centers and have found that most of them actually are operating correctly.
Well, I will say it is disappointing that you had a chance leading a nonprofit that is supposedly pro-democracy to take a principled stand. Instead, you decided to defend the Somali fraudsters because it benefits elected Democrats. That's disappointing. But you know what? I'm going to give you something you're going to like, an opportunity to say all the ways you dislike President Trump, because I'm going to recognize the ranking member who will surely ask you why Trump is terrible and do everything you and he can do to change the topic from the actual topic of this hearing. Ranking member Whitehouse.
Before we get to that, I don't want to leave what seemed to be a pretty flagrant mischaracterization of your testimony without an opportunity for you to address that mischaracterization, if you would care to begin with that.
I appreciate that. Just briefly, I was disagreeing with the premise of the question that we have been displayed this evidence showing criminal wrongdoing. Obviously, where there is criminal wrongdoing, and I testified to this, I support aggressive investigation and prosecution. To the degree there is wrongdoing in Minnesota, it should be aggressively investigated and prosecuted. I'm not sure that the claim that all the evidence we've been presented today is in fact evidence of that, but I don't deny it for a moment that it is occurring in Minnesota.
Let me ask you another question. In a democracy, is there a significant difference between private individuals engaging in fraud and self-dealing against the government and government officials, public officials, engaging in fraud and self-dealing against the government?
They're both wrong, concerning, problematic, but the betrayal by public officials is morally and from a political point of view more consequential.
Yeah, it's a worse element, isn't it? So the chairman has pointed out that President Trump did not run a fake daycare. What are the 4 or 5 things that Trump did that used his position to enrich himself and his family at the expense of the American taxpayer?
Well, I detailed this in my testimony. Most shockingly is the report from the Wall Street Journal this past week about a Trump-connected business partnering with UAE in a deal that directly put $187 million in the pockets of the president and his family. He additionally has joint ventures or elaborate licensing deals with Saudi companies, companies from Qatar. He's engaged in this elaborate cryptocurrency arrangements that have made him at least $2 billion by independent estimates, and maybe even more, just in the course of the last year.
And let's look for a moment at the pardon process, which used to be operated under the supervision and scrutiny of the Department of Justice and now appears to have moved to the lounge at Mar-a-Lago. It seems that there is a pay-to-play arrangement by which people can acquire pardons. Can you elaborate on that?
You know, well, we see the president use his pardon power aggressively, and I don't begrudge him for doing that whatsoever. But what is shocking is that leaving aside the January 6 pardons, they've been so heavily focused on those who've committed white-collar crimes and particularly fraud
crimes.
People who have committed those crimes, shown no remorse for those crimes, owed restitution for those crimes, or excused for restitution for those crimes, and who appear to be getting off because of their connection to the president, because they've hired high-priced lobbyists to get them there, or they or their families have made contributions to the president's political committees or those that benefit him directly.
Do you think that fits into what the public generally understands to be pay to play?
Yes, sir.
So we are now in a political environment in government in which the cops basically have been defunded or fired. The inspectors general have the job of rooting out fraud and corruption. What's the Trump administration doing if it's concerned about fraud and corruption with the Inspector General Corps of the United States?
Well, I don't believe it is concerned about fraud and corruption. I believe it's effectively advancing fraud and corruption, including by eviscerating the IG community. As I mentioned, 2/3 of the IGs presidentially appointed have been fired by this president, and the IG staffs are massively diminished in just 1 year. These are the agencies that are in charge of doing exactly what we're talking about in Minnesota. It's their job to find that kind of fraud. If there was a genuine commitment to being worried about that fraud, not for partisan reasons, but because we actually cared about fraud, we'd be, as Senator Grassley said, supporting and strengthening that IG community, not cutting it off at the knees.
My time is up, and I've paid the members the courtesy of staying within my time.
Senator Schmidt.
Thank you, Mr. Chairman. American citizenship is a gift, but also a sacred duty. It comes with extraordinary rights and important responsibilities. Responsibilities are a precondition to those rights. That's why our forefathers created strict rules for naturalizing new citizens. On the front end, those who wish to become Americans must prove they are persons of good moral character and loyal to our country and attached to our Constitution. On the back end, we have the ability to revoke the citizenship of those who lie or deceive us in the process of securing it. We've seen those standards of citizenship be debased. Look at the stories of just the past few months in Minneapolis. Case after case, naturalized U.S. citizens behaving in ways that show beyond any shadow of a doubt that they were never fit for citizenship in the first place. In Minnesota, naturalized citizens defrauded our government for billions of dollars. One individual stole almost $1.7 million from a program intended for poor children. Just today, a naturalized citizen in Massachusetts pled guilty to stealing over $1 million from our welfare programs. Something has to change. It's why I've introduced the SCAM Act to expand and accelerate our ability to denaturalize people who should have never become citizens in the first place. If you use your new citizenship to commit massive welfare fraud, aggravated felonies, or espionage, or join drug cartels or terrorist organizations, you were never fit to be called an American at all. I encourage my colleagues on this committee to support that important legislation. Now, Mr. Weissman, you are the co-CEO of Public Citizen, is that correct?
Co-president, yes.
Okay, president, okay. Is welfare and grant fraud in the national public interest?
I'm sorry.
Is welfare and grant fraud in the national public interest?
It is
Addressing
100% contrary to the national interest.
Okay, but taking it on would also be in the national interest, correct?
Taking it on is absolutely in the American interest.
Is fraud prevention is fraud prevention racist?
Fraud prevention is not racist, no.
Okay. Are current fraud prevention efforts by the Trump administration in Minnesota racist?
No.
Okay. Are deportations racist?
Are deportations racist? It depends. They can be racist, for sure.
Is ICE racist?
I think the practices of ICE right now are poor and should be abhorrent. Exactly as you said for American values. I think the practices of ICE right now are.
But ICE itself, the organization, is racist.
The enforcing immigration and customs laws per se is not racist. What ICE actually is doing, I believe, can fairly be characterized as racist.
All right. I asked this because we did a little bit of digging into Public Citizen and found two things. One is you're funded by George Soros, correct?
The Open Society Foundation is one of our funders, yes.
And you call just about everything you don't like racist.
That is not true. But
okay, well, let me give you a few examples.
Sure.
On December 11th, 2019, Public Citizen tweeted that the banking sector as a whole is racist. On August 17th, 2021, Public Citizen sent in a press release that algorithmic racism was a major problem and that we need to start creating anti-racist algorithms. On December 23rd, 2020, Public Citizen tweeted that our healthcare system is a racist abomination. On April 7th, 2023, Public Citizen tweeted that expelling 2 Tennessee state reps for violating the legislature's rule was racism. On April 15th, 2021, Public Citizen tweeted that law enforcement in this country has been overrun by racism. On June 25th, 2020, Public Citizen tweeted, racism is the reason D.C. is not a state. On January 15th, 2019, Public Citizen tweeted that asking about citizenship status on the census was racist. On August 24th, 2020, Public Citizen tweeted, defund our racist, hyper-militarized, murderous American police force. On July 10th, 2020, Public Citizen tweeted that law and order is a racist dog whistle. Do you stand by these statements?
Well, I appreciate the depths of which you've gone to research. In context of all those statements, yes, sir.
So all of those things are racist.
If you want to go through them, we can talk.
So here's, I'm really glad. Hold on. I'm glad for this moment of clarity because a lot of witnesses would try to sidestep that.
That's correct.
But what you have shown in the questioning we've seen before, and just these examples, the public interest isn't your interest at all. It is not your interest at all. You use racism as an attempt to intimidate people to get your way. And it's not 2020 anymore. The American people are over it. So what you're going to find is we're going to prosecute, and it has nothing to do with race. We're going to prosecute because fraud was committed on a level that is so offensive to this country. Your words that don't mean anything aren't going to stop what's coming. And I want you to take that back to George Soros and all these ridiculous funders you have to try to muddle the issue because justice is coming. And by the way, if I have it my way, we will denaturalize all these fraudsters and send them home. Mr. Chairman, I'm out of time.
Senator Hermano.
Thank you, Mr. Chairman. This is a hearing about fraud, and I would say that that includes corruption, political corruption. So I want to talk about political corruption in this regime. There are so many examples of political corruption in this administration, in this regime. And the thing is that what is astounding to me is that this corruption, which is fraudulent, costs people money, is so overt. And I know that at least Mr. Weissman has talked about some of this corruption, but let me just repeat some of this because I think it's important for our American people to know what is overtly happening in our country that constitutes political corruption and, in my view, fraud. For example, President Trump accepted a $400 million jet from Qatar that he plans to keep. He plans to keep after his time in office. What is that? Overt. Members of Trump's team, including Kash Patel and Kristi Noem, use taxpayer-funded private jets for personal travel, to visit with girlfriends, to go to golf courses. Overt. Tech billionaires have received special access to the White House in exchange for paying for the president's new ballroom in the East Wing. And as noted, a lot of these tech billionaires want something from the White House. That's why they're doing this. I'd say, it's practically extortion, if not extortion, for this kind of overt kind of corruption to be happening. And then Trump's family has made at least $5 billion from the same cryptocurrency market that Trump's administration refuses to regulate. And in case anyone needs a reminder, the president himself was convicted of 34 felony counts of falsifying business records. That is called fraud. Mr. Weissman, I want to ask you a few questions about all of this overt corruption. Now, as mentioned, Trump has pardoned dozens of people, including several of his billionaire buddies. Many of these pardons followed $1 million or more contributions to support the Trump campaign from friends and family of the convicted criminals. For example, Trevor Milton was serving a 4-year prison sentence and owed $695 million in restitution to victims, and he was pardoned. So all that restitution money, forget it, forgiven. pardoned by Trump after he and his wife contributed almost $2 million to support Trump's campaign. Paul Walzak owed $4.4 million in restitution to victims and was serving an 18-month sentence when Trump pardoned him following Walzak's mother spending $1 million to attend a Trump fundraiser. Julio Herrera was pardoned after his daughter contributed $1 million to a Trump super PAC. Mr. Weissman, do you see a pattern here?
I think the pattern is exactly what you're saying, Senator, which is that people who've made contributions to the president's political committees or who have hired lobbyists spending a lot of money, the people who are close to the president, have managed to finagle pardons without showing any remorse and irrespective of the harms they perpetrated on victims.
Hundreds of millions of dollars literally in restitution out the window. So what do you call this kind of behavior? I call it corruption. And do you think that this pattern of Trump basically holding out his hand and extracting all this money from people for pardons and everything else, do you think that that pattern will cease?
I think there is a 0% chance of it ceasing unless the people and this Congress demand that it does so.
I do want to mention, that the DOJ is actually doing an investigation. In fact, they're following up on a lawsuit that was originally filed by Biden against Ticketmaster, which sells tickets, owns venues, contracts with major performers, that they pretty much run the whole show. And this allows Ticketmaster to literally screw over fans. And so the Biden administration sued them for anti-competitive practices. Now, one hopes that this lawsuit will continue, but now we are hearing that well-connected Trump world lobbyists are pursuing the Trump DOJ to drop the case. And this is reminiscent of the same lobbyists getting the Trump DOJ to drop another lawsuit from going forward, and they did so. So would you be surprised if this Ticketmaster lawsuit goes away and the Ticketmaster customers, which number in the millions, will continue to get screwed? Would you be surprised if this lawsuit goes away?
I would not be surprised.
Okay, there you go. Corruption, rampant.
Senator Cornyn.
Am I pronouncing your last name correctly, Mr. Hock? Hoke? Thank you, Mr. Hoke. Do you think this kind of fraud is isolated in Minnesota? Do you think it's pervasive? Do you think it just is a case of child care fraud, or would it apply to more broadly to various non-governmental organizations that are given contracts by the federal different federal departments? Here, why don't you get your microphone up there? Yes, sir.
I think it covers almost every organization, nonprofits, NGOs, healthcare, adult daycare, autism centers. And so I want to go back to something Mr. Weissman said. So this is the second time now that he has questioned my data. He was just discredited. So I offered in my second video $100,000 to anybody who could prove my data wrong. So I stand by it.
Okay.
I'm sorry, Senator.
No, you'll have plenty of chance to refute what you disagree with there. But so not limited to daycare, not limited to Minnesota. Are you continuing your investigation beyond Minnesota?
I am, and I've heard from every state in the country where people are uncovering the same sorts of fraud. I can't say it's exactly the same, but every day I'm getting emails, I'm getting messages. I'm in Ohio, I'm in Washington, I'm in California, Texas, all over. We're finding the same types of fraud here, and I can't. It's so massive that I can't possibly help everybody.
Mr. Chairman, I have a document published by the Board of Governors of the Federal Reserve System, nonprofit organizations total assets level, dated January the 9th, 2026. I'd ask unanimous consent to make that part of the record.
Without objection, will be admitted.
So this document, and I'm happy to show it to you, shows that there are $13 trillion in total assets that are in the hands of NGOs or non-profit organizations. Does that number shock you like it shocks me? 13 trillion.
Well, Senator, I think what happens is we've become desensitized to these big numbers because we hear them so often. It's a shocking number all on its own. Yes.
So it strikes me part of the problem is when the U.S. Congress appropriates money, they're appropriated usually to federal agencies, and then they contract with NGOs and others. And I think one of the things we need to look at is what those contracts provide for, and particularly with regard to the requirement for audits on a periodic basis. But you're concerned about fraud being more pervasive and extending beyond Somali child care in Minnesota. Would it also extend to these $13 trillion in the hands of non-governmental organizations?
There's certainly going to be a good portion of that is fraud. Now, one of the reasons that I don't have a clearly defined number on the amount of fraud is because 4 times I've requested from the state of Minnesota the data for the payments, the Medicaid payments going to these transportation companies. And remember in the video, Nick and I went, and none of them existed. One was a liquor store, one was a grocery store, one was a mailbox. And so the state won't turn over to me the amount of money that these companies are getting. That's why I had to take a national average in the video, and that's how I came up with the number, and it's staggering.
So what sort of recourse in terms of recouping the amount of money stolen in the Somali daycare operation?
So
how can that money be recouped if it can?
Well, you're never going to get it all back. But again, we have to stop worrying about suitcases full of cash at the airport and transfer wires going to Saudi Arabia and Kenya and all these other places. You've got to cut the money off at the source, and you've got to go to these social service agencies and tell them if you write a fraudulent check, you run the risk of going to prison, period. You have to have that sitting there. So they're going to think twice before they issue a payment because they might end up in prison because it's a felony.
Thank you, Mr. Chairman.
Thank you. Senator Graham.
You're telling me that there are companies that are listed that receive transportation payments that don't exist.
When I say they don't exist, all they are is registered with the state of Minnesota. They're a slip of paper. They don't exist. They have no office. They have no asset.
So it's a scam.
It's a total scam.
So here's to the people of Minnesota. Your governor, you better answer these questions. What can we do? We can get you here and hold you accountable for the programs you're running in Minnesota. Ms. Robbins, are you here to tell me that the system in Minnesota is broken and you're having a hard time getting people to help you?
Thank you. The system is absolutely broken. There are fraud on multiple levels. There are failures of internal controls. And finally,
you're
we
telling
have
me
help
your
from the
state
feds.
has not been responsive.
No, they have actively, I would say, harmed whistleblowers who tried to point it out, and they have tried to shut down investigations.
You said fake meals for fake kids.
Yes.
Would it help if you had to biometrically identify recipients of aid, that they'd have to be biometrically identified to prove they exist?
I think it certainly would help. I'm a privacy advocate, so I'd want to understand the details
Well,
of that.
number one, prove you exist.
Yes, prove you exist. Like very basic.
That's not a privacy problem. If I'm going to give you money, is it too much to ask that you prove you exist?
No, that's why we need documentation.
Well, that's coming.
Not attestation.
We're going to fix this. It's coming. We're not going to sit on the sidelines and watch billions of dollars go to organizations that don't exist, rows of daycare facilities that don't provide daycare. It's in Minnesota. Bless you both trying to fix it. Is there any doubt, Mr. Hoke, to the extent of the problem that is billions in Minnesota?
Again, we don't know what the number is going to be. It's going to be, it could be 80 billion if you go back.
You just don't know.
We don't know. But to the point about politicians knowing, so I filed a criminal complaint against Governor Walz for violating the law for not reporting fraud.
I think when you ask the Medicaid services in Minnesota, tell us who you give money to, that's not unreasonable. So what I would think this committee should do, quite frankly, is that we should ask for an accounting. When Minnesota wants to get reimbursed for SNAP benefits, are you familiar with the SNAP program?
Yes, sir.
Do you have to provide names who got the benefits, or they just give you a number?
My understanding is that there is a list, and the federal government is trying to get it from Minnesota.
Well,
but
I'm telling you we can't.
Right. They're stonewalling.
That's right. They're stonewalling. Taxpayers, minority taxpayers, no matter what the color of your skin, you work hard for your money, and the people at the top in Minnesota are trying to perpetuate the fraud, in my view. You can say what you want to about Trump. That's not why we're here. Seems to me that we would want to make sure that a transportation company on paper actually exists. It seems to me that if we want to feed a kid, they actually exist. And you know what? They're not giving us the data to prove that they actually exist. So how in the world can we, as the federal government, allow this to continue? We are not. Ms. Robinson, are you begging us to help you?
Yes, and we're grateful for the help that's come recently from the administration and from our partners here in these committees.
Mr. Hoke, are you begging this committee to help you?
Yes.
Message received. Mr. Weissman, I don't want to waste your time or mine. Bottom line is, we're going to find a way to help the taxpayer. I don't mind. I like feeding kids who are hungry and can't afford to get a meal unless they get one at school. I don't mind helping Medicaid people to get to where they want to go. I do mind when we're getting ripped off. And to the leadership of Minnesota, your day is coming. And if you think it's just Minnesota, Senator Cornyn, you're right. It's everywhere. And we're going to find it. That's the least we can do as managers of these programs. God bless you all.
Thank you. Senator Lee.
Thank you, Mr. Chairman, for organizing this hearing, each of you for being here. The United States of America is one of the most generous countries in the entire world. It also happens to be one of the most upwardly mobile countries in the entire world. It's somewhat unique in the sense that a person can be born into poverty here or arrive here as poverty, as a refugee or otherwise, and have the reasonable hope and expectation if they work hard, one day they are likely to be able to retire comfortably, if not wealthy. This requires access, not so much to government programs as to robust institutions of civil society and free markets, more than anything else, much as many would like to have us believe otherwise. Key to those institutions of civil society are these charitable activities to which I referred. Americans donate nearly $600 billion a year in charity every single year. This in addition to an estimated $1.8 trillion annually that federal and state governments spend on anti-poverty welfare programs, not including things like Medicare and Social Security that are about retirement rather than anti-poverty measures. Now, if you ask almost anyone, which of those programs, whether a government program, whether state or federal, or very often it's a state program administered by states with a lot of federal funding, sometimes it's one or the other, very often there's a mixture. If you ask them, what has a greater chance of achieving what I think should always be the ideal of any welfare system, the objective, which is to make poverty temporary rather than tolerable. I think 9 out of 10, perhaps 99 out of 100 individuals would say that it is privately funded welfare programs. Why? Well, because they're set up in such a way that they can be much more about the individual. They can be much more about identifying ways in which you can make poverty temporary rather than tolerable. In fact, one could argue that for these government programs, it's even too complimentary of many of the government programs to say that the objective is to make poverty tolerable rather than temporary. Very often the objective is to facilitate the very kind of waste, fraud, and abuse that we see here, that we're examining here today, in a relatively discrete part of the country involving the Somali community in one state, Minnesota. So lest we delude ourselves into thinking that this is an aberration, lest we delude ourselves, alternatively, into thinking that, oh, all we need are better, smarter managers, more efficient people who will suddenly identify and become enlightened as to best practices to make sure this doesn't happen. This is what this thing does. You don't put a hornet's nest in your child's bedroom and expect that it won't cause problems at some point. You don't release blank checks and allow those blank checks to be cashed at will by people who are not directly paying the bill because somebody else is. 350 million Americans are sharing in that burden, and expect there not to be fraud, not just occasional fraud, but massive, earth-shaking kinds of fraud that cause people to lose faith in the system. Meanwhile, what is it getting us? Under these systems, particularly the federally funded state-administered programs, under what circumstances do we have evidence that this is making poverty temporary rather than tolerable? And in what circumstances do we have evidence that it's not facilitating fraud? So let's not kid ourselves. This is, if anything, the tip of the iceberg. It happened to manifest itself very well because of Nick Shirley and a few other brave journalists who stepped into the fray on this one and have taken a lot of heat as a result. But I suspect that this is the tip of the iceberg. Mr. Hope, in your view, did the Minnesota state government, either through incompetence or willful ignorance, reckless blindness, or otherwise, did it enable the Somali fraud in Minnesota?
Yes.
How did it do that?
Complicity.
Complicity with what degree of awareness as to the level of fraud that was being undertaken?
100%.
100%. So this was not a bug, was it? This was a feature. So when we look at the fact that the federal government is $38.5 trillion in debt, when we look at the fact that we've impoverished Americans, keep in mind, when we spend this much money that we don't have, adding to that $38.5 trillion debt at a staggering rate approaching $2 trillion a year, what does that do? I'll give you a hint. It is not the rich people who suffer. Rich people find ways of getting even richer during times of tremendous inflation. It is hardworking Americans, especially poor Americans and middle-class Americans who are living paycheck to paycheck. They are the ones who suffer. And damn all of us if we don't look out for them. Shame on all of us if we don't fix this. And by fix it, I don't mean get smarter people, teachers. I mean, maybe we should start looking at the fact that our Constitution puts this government in charge of a few things: national defense, wages and measures, trademark, copyrights, and patents, regulating trade or commerce between the states with foreign nations and with the tribes. There are a few others, but that's the lion's share of the power. We were not equipped from the beginning to be a welfare agency. The word welfare appears exactly twice in the Constitution, once in a non-operative, non-authority granting preamble, and a second time in the spending clause, which was included as a limitation on the spending power rather than an expansion of it. There is no power to just look out for people generally, unless we rely on a bastardized version of the Constitution that has driven us into $38.5 trillion in debt, crippling poor and middle-class Americans with destabilizing inflation that it makes it impossible to raise a family in this country. And shame on all of us if we don't take this as a severe wake-up call, because this is going on all the time. Thank you.
Thank you, Senator Lee. This concludes today's hearing, although I will note that Governor Walz and Attorney General Ellison and Mayor Frey were invited. They could have come here and answered questions. They could have presented some sort of defense that they were not, as Mr. Hoke just put it, 100% aware, 100% complicit, and indeed personally and politically benefiting from robbing the Minnesota taxpayers. They chose not to do so. But I'll make clear that invitation remains open. Governor Walz is welcome to come to this committee. Attorney General Ellison is welcome to come to this committee. Mayor Frey is welcome to come to this committee. And I'll tell you this, I won't hold my breath waiting, because all three have entered witness protection when it comes to fraud in the state of Minnesota. Written questions can be submitted for the record until Wednesday, February 11th at 5 p.m., and I will ask the witnesses to answer and return the answers to the questions to the committee by February 25th at 5 p.m. And with that, this hearing is adjourned.
They immediately start making up fake news.
Whoa. Get out of the way!
Whoa. So this gentleman right here, he just assaulted us. Uh-oh, he's getting mad. Yeah, you can tell. This is somebody that gets mad.
Mainstream media is here, and we asked if they wanted to cover this, but they said no. Do you want to cover this? We're being followed.
He probably just doesn't want to get his camera broken. I'm going to be honest.
In
I
a
think that's
peaceful
pretty
march
fair.
through Center City, hundreds of Philadelphians filled the streets, holding signs, chanting, and saying showing up felt like one small way to stand with people in Minnesota.
Oh my God. They immediately start.
Yo, they just kicked it into overdrive. What I'm about to show you, I swear to you, it is propaganda of the highest order, and we are going to destroy that from orbit right now, because one of the things that I cannot stand is when they lie so overtly to you and I. The impunity is just insane. We're going to walk through the entire thing right now. Of course, I'm talking about the far left media saying that now the Republicans are going to lose the Senate. Yep. Guys, the amount of caveats and the amount of stuff that you're about to see is laughable. So please, if you're enjoying the content, if you are looking for a ray of sunshine amongst all the doom and gloom, this is the place to be, because I'm going to bring you reality and I'm going to show you all the receipts in the description box below. Hit that like button, subscribe to the channel, turn the notification bell on if you are down to save the country with me and, honest to God, defeat the insanity. Here we go. I'm not going to bury the lead. You can follow me on X at BradenLOA. So, y'all, big news, huge news. Now, the far left Axios, the place that floats all the trial balloons, the place that makes Politico look conservative, is now saying, for the first time, guys, GOP strategists are telling Axios that losing the Senate, where Republicans have a 53-47 majority, is a distinct possibility. Wait until I show you the calculus they put forward and then how they backtrack the entire thing at the end. This is 100% pure and total copium, hopium, and propaganda. This is going to be fun. According to GOP internal polling, even deep red states like Alaska, Iowa, and Ohio are now in play. Two GOP strategists acknowledge that immigration and the economy, I'm going to show you that in a second, the two issues that drove Trump's win in 2024 are now liabilities. A year ago, I would have told you we were almost guaranteed to win the Senate. One GOP operative who reviewed internal polling told Axios, today, I would have to tell you it's far less certain. Yo, this is simple, and I'm going to get into this whole thing for you. Vote like you're losing, grind like you're losing, share like you're losing, send this stuff out like you're losing. If you have that mentality, I don't care what the polls tell me. I know that I'm going to grind and I'm going to work and I'm going to do everything I can to prevent the guaranteed loss from happening of the Democrats. It's not that hard. Anyway, let's keep on going. There's another post from Political Polls referencing the exact same article, but let me get into this real quick for you. Let me show you the depths that they have to go to basically discourage you and dissuade you from voting, because this is what this is. This is meant to be a push poll. This is supposed to push people, okay? Watch this. The GOP's new fear, losing the Senate in November. Oh my God almighty. Okay, just wait. Look, they've even made a elephant with a tear coming down its eye. So you know it's good. Yeah, okay. Everything's linked in the description box below, and I'm just going to start going. Here we go. Top Republicans are increasingly worried about private polling that paints a dire picture of the midterms. And it's not just the House they're afraid of losing, it's also the Senate. For the first time, GOP strategists are telling Axios that losing the Senate, where Republicans have a 53-47 majority, is a distinct possibility. And that they'll have to fight harder than expected to keep control. Hold that right there, okay? I'm going to double highlight. And they'll have to fight harder than expected to keep control. Okay, then you fight harder. This isn't difficult. It is comical. Oh my God, because they're going to have to fight harder when they have national headwinds against them, which have proved to be about 98% accurate, that the House is always flipping, because that's just the way the American population psyche works. So they'll have to fight harder to keep control. Yeah, no kidding. Again, please see the reason I show you that. $694 million versus $167 million. Yeah, you're going to have to fight harder. That's why you have a war chest of almost 6 times your opponent. Congratulations. Spend it. Okay, let's keep on going. Again, I cannot stand when they lie to you this hard. Operatives say they've reviewed polling that shows the GOP facing competitive Senate races, not just in traditional battlegrounds such as Michigan, Maine, and North Carolina, but also in conservative states like Alaska, Iowa, and Ohio. I'm going to highlight this in red, and you know what that means if you're a veteran of this channel. Immigration and the economy, the 2 issues that drove the win, are now liabilities. I'm going to come back to that in a sec. You know what? No, I'm not. I'm going to do it right the frick now. Who wants to tell them that the immigration is a supermajority in support of what the Republicans are doing? Like I've shown you multiple polling. Like what about that is all of a sudden net negative? It literally is a supermajority popular position for the deportation of illegal immigration. Beyond 60%. Sanctuary cities, get rid of them. Like literally, immigration is now a win. That's the big tell, by the way, other than the fact that this is coming from Axios. A year ago, I would have told you we're almost guaranteed to win the Senate. On one GOP operative who's reviewed internal polling told Axios. Today, I would have told you, I would have to tell you it's far less certain. Nothing's certain. No kidding. See how they're wrapping all of this very vague language and then translating into a guarantee? See how that works? Don't worry, they're going to reverse course at the end, buried all the way at the end of the article, but let's continue. Tim Scott, chair of the National Republican Senatorial Committee, delivered a sobering message about the party's headwinds. A slide presentation indicated the party's toughest challenge, based on its national polling deficit, is in Maine, where Republican Senator Susan Collins faces a tough path to re-election. I guess it would be a good time for me to drop this little bad boy that just came out. 2026 Maine race, Susan Collins, according to the polling, has gone up above Janet Mills and gone up above Graham Plattner, the progressive boy wonder with Nazi tattoos on his chest. Not hyperbole, not making that up. It's there. So that right there, all of a sudden, that's the biggest headwind. Okay, I accept the fact it's the biggest headwind. Spend more money. Okay, watch this. Even if Democrats fail to win the race, Republicans now will need to spend potentially tens of millions to defend those seats. Yeah. Again, let me draw you to the prior attention. $700 million versus $167 million. That's the whole point. But they're couching this as, oh my God, they're going to have to fight harder, so they might as well not. Idiots. All right, let's keep on trucking. Now we're going to talk about Texas. Again, you're going to start to see a theme, and then the whole thing's going to Uno reverse on you. Even if Paxton wins in November, many Republicans warn the party will have to unexpectedly spend tens of millions of dollars more than if Cornyn is the nominee. I don't care. They have $700 million versus $167. Yeah, spend $10 million of it. All right. Get rid of the Rhino Cornyn because he's a liberal anyway. This is not difficult. Democrats haven't won a statewide race in Texas in more than 3 decades, but now the Republicans are going to spend more money in Texas. So, oh my God, they're going to lose for sure. It's wild. And here comes the reality check. Notice how all of that was at the top. I swear these people are just you do not lack respect for media and reporters enough. Here we go. Reality check from Axios. It's far too early to make dire predictions about how Republicans will fare in 2026 races. Did you read your article you just wrote? The primary season has barely begun, and Democrats could nominate weak contenders in such states as Iowa, Maine, and Michigan. You mean like, I don't know, this guy right here who has Nazi tattoos on his chest and is a far-left progressive psycho? Antifa ties, socialist ties. Yeah, they could. It's possible. God, yeah. The pro-Senate GOP has nearly 3 times as much cash to spend as its Democratic counterpart. Funny how you didn't mention that at the beginning. The GOP will also benefit from the pro-Trump MAGA Inc. Super PAC, which has a staggering $304 million in cash on hand. Again, funny how that didn't come up. And then there's the mega donor Elon Musk, who's been cutting big checks to conservative PACs. So just completely and totally wiping out everything that you just said as a hit piece article meant to manipulate people's emotions. Y'all, you have to understand, all of this is noise. If you lose in November, you lost in November. If you win in November, you win in November. The main line that I'm going to continue to do day in and day out is tell you to vote like you're losing, grind like you're losing, work like you're losing, and share like you're losing. Anything else is noise. Because if you grind and your neighbors grind and your family members grind and they are grinding for the betterment of the nation, I don't care what Axios says, even in their insane manipulation and propaganda articles like you just saw here. It is wild. But anyway, I'm going to keep on fighting, and I hope you guys enjoy. Let me know what you think in the comments below. I'll see you on the next one. I'm Braden. Later.